give the floor, more properly, I will give the access to the screen to His Excellency, the Minister of Foreign Affairs of Finland, Pekka Haavisto. Thank you very much.
Estamos então a ver a intervenção do Ministro das Finanças, Ministro dos Negócios Estrangeiros. Peço.
Plus and the Clube of Lisbon for taking the initiative for this important conference and for inviting me to join you today. Let me start by congratulating the G7 Plus members for having drawn the world's attention to the severe impact of the COVID-19 pandemic on fragile states and vulnerable communities. Your joint statement of solidarity and cooperation issued last year described well the specific challenges and threats posed by the pandemic on fragile states. It was an important call for global solidarity, cooperation and coordination. It was a great pleasure for me to visit the G7 Plus European Hub in Lisbon last month and to address...
da Costa, consegue ouvir-me?
Sim, sim.
O senhor Olivier... peço desculpa, embaixador, não...
Ok.
They lack information to channel the scarce resources they have in the best possible way. Worst of all, they often struggle to deliver services while suffering from violent conflict and in some cases are not able to control parts of their territory. And during this pandemic, they have seen their ability to counter the virus further erode as the countries with better resources to fight the pandemic have not been able to help in the way that was needed and indeed hoped for. This is not to say that we in Europe would not be doing our utmost to help the developing countries in their fight against the pandemic. With over 2.8 billion euros, the EU and the member states are the single biggest source of funds for the COVAX facility. Finland has channeled over 100 million euros, including support to the safe functioning of health systems to countries most affected by the pandemic. Many countries in Europe have also described to offer vaccines to those countries in need. Outside of Europe, new promises and initiatives from, for example, the USA and Canada increase the amount of much needed help and support. I believe that the amount of vaccines and other medical help will further increase with the ramping up of new lines of production. So a lot of help is on its way or has already arrived. But I still believe that all of us should do more. We should try to get in more help more quickly. More important yet, we should coordinate with the recipients more widely, more thoroughly, and more efficiently. However, the great problem that I mentioned in the beginning is brought back to center stage. Fragile states have limited resources and information to work efficiently against the pandemic. Internal conflicts further erode their possibilities. It is therefore of great importance for the people of fragile states that their governments and insurgent groups let international organizations like the WHO to carry out their work in the best way possible. It should be clear to everyone that this work benefits everybody, even if it's in some cases carried out in areas controlled by the opposing force. A pandemic does not ask political affiliation when it strikes. This is not to say the insurgency should be given the same status as an internationally recognized government in international cooperation. Rather, ordinary people pay the price of inaction regardless whether they live their lives in the territory controlled by the government or the insurgency. Everyone will lose if the pandemic roams rampant within a country's territory, because in addition, to not having a political affiliation, the pandemic is perfectly capable of crossing front lines between the varying parties. Moreover, from there, it can cross borders and continents to an airport near you. It is the common interest of us all, wherever we are, that this should not happen.
Go live in 5,
Thank you.
4, 3, 2, 1. We are live.
Good morning to everyone. Mr. Chairman of the Club of Lisbon, Ambassador Francisco Seixas da Costa, permitam-me que envie uma saudação especialmente cordial.
Allow me to send a very special greeting to all the participants of this opening session and all participants of the special sessions and members of the panel, as well as to the public and the audience. I'd like to take advantage of this opportunity to participate in this conference promoted by the Club of Lisbon and G7+, which counts on the institution I'm director of the Instituto Camões. Portugal has been following the work of G7+ ever since the creation of this group more than a decade ago. And we congratulate ourselves with the relevance it has been acquiring as a collective voice in negotiations with international partners, so that those who face conflict situations or other types of fragilities are not in such an unequal position in bilateral and multilateral negotiation. G7+ is also a space for hope amongst peers. Let's see an example of East Timor. When we created this group, East Timor was the youngest country in the world. They faced all sorts of challenges which are specific to the first years of democracy and the construction of the rule of law after decades of occupation and violence. And now we can all be proud of the fact that East Timor is no longer in the list of fragile states of OECD, according to the report State of Fragility 2020, and is still a very important pillar within this group, very active partner, namely in terms of resilience, and an example that it's possible to overcome the most dramatic situations, and a very important role model for its peers. And I believe that this support to the fragile states has been a great aim of Portuguese collaboration in bilateral and multilateral levels. So bilateral level, we know that to have resilient societies, we need strong institutions. Our main focus has been the institutional support based on mostly on education, health, and rule of law. And of course, also taking on board community development through civil society organization, as well as development of the private sector, which is specific of the resilient societies. At multilateral level, one of the negotiations of the 2030 Agenda for Sustainable Development, we were on the side of G7+, defending the integration of SDG 16, peace, justice, and effective institutions in this global agenda. Portugal has also supported G7+ in obtaining the statute of observer before the United Nations in 2019. We are now committed as a country, and again, to pursue our collaboration to G7+ towards sustainable development and institutional resilience, as well as facing new challenges that the current pandemic is bringing about. and its impact on the most vulnerable. We support the appeal of the Secretary General of the United Nations, Mr. Guterres, for a global ceasefire so as to combat more effectively COVID-19 pandemic. And we are sure that this should be the strong combat that we all have to lead right now. We defend universal values, dignity, solidarity, universal access, equitable access to health care and vaccination, strengthening of health systems, international cooperation and multilateralism towards a sustainable recovery that is also inclusive and resilient, because the global dimension of pandemic requires a collective effort to try and find multidimensional solutions for a common problem. The pandemic is not merely a health crisis, but also a social, economic, humanitarian crisis, and also with a strong impact on human rights, which is now questioning many things which were obtained in terms of the Sustainable Development Agenda. Only through joint work and following the spirit of solidarity can we face the devastating consequences of this crisis, which affect all countries and represents another challenge for countries in fragility or those who are affected by conflicts, given their institutional weakness and their restricted ability to mobilize resources. In accordance to data of the WHO, the number of cases at global level since the start of the pandemic is around 179 million people, and around 4 million individuals were deceased, and we can't make an estimate of how many more lives will be lost. And given the difficulties in diagnosis and data consolidation in certain geographies, namely in situations of crisis or countries which are affected by conflicts, we believe that the reported cases do not truly reflect the true dimension of the problem. More infectious variants make probably even more difficult what and maybe impossible what we have attained in terms of vaccinations. Our ability to develop scientific efforts enable us to attain vaccines at an unprecedented speed. This is a factor for hope, but there's still a scarce asset, but nobody will be safe unless everybody is safe. And this is a premise which is true while the pandemic is here. More than ever, and these are my final words, multilateralism and its importance is undeniable, and international community should follow convergence, cooperation and solidarity to guarantee vaccination at worldwide level. Vaccine should be considered as a global public good, accessible and affordable to all. The place where we were born should not dictate our position in the waiting list for vaccination. Following these lines, Portugal promotes a coordinated, concerted, multilateral response to pandemic, and we have invested 10 million euros for the so-called global response to COVID-19. Part of this amount was directed to accelerate access to COVID-19 tools initiative, which was launched last April under the leadership of WHO, to accelerate the means to access equitable treatment tests and of COVID-19. We are on the right path to combat pandemic, but we have not yet won the war. Far from it. It's important to guarantee the equitable distribution of vaccines, leaving nobody behind. And this is not just a question of solidarity. It's the only way, I repeat, the only way of facing this common threat. Lastly, to conclude, the context of fragility requires more effective action in other areas. And to strengthen fight against climate change, So I believe that humanitarian aid, development and peace and the different stakeholders work together so as to strengthen the complementarity of their actions in this context. You have to be proactive, and in combating a pandemic should be the focus, but we cannot be distractors. Otherwise, we'll see a greater climate catastrophe and a growing inequality. Responding to crisis should be a global effort and to strengthen social contract with those countries which are more fragile, besides the long-term, short-term access and promoting better institutions, promoting social cohesion, strengthening the social contract, and contributed towards conflict prevention. Thank you very much for your attention.
Distinguished participants on this conference, unfortunately for the moment, it is impossible to have the presentation to be made by the president of G7+, the Minister of Foreign Affairs of Sierra Leone, Mr. Francis Kaikai. This intervention will take place in another moment of this conference, and now we suspend this initial session, and we'll come back at 9:45 for the first panel of this conference. Thank you very much.
Quem vai entrar agora? Vai entrar o 3? Pode? Fala. Helder, fala. É para ir falar o Helder ou não? É para lançar o cartão.
Obrigado, Jéssica. Francisco. Um abraço.
Mas o Helder tem que falar, o tal e a boa tem que estar a falar. Ele tem o microfone desligado.
Helder, you need to turn on your microphone. Ok, muito obrigado. Excellencies, ministers and speakers, ladies and gentlemen. First of all, I would like to apologize due to some challenges in terms of connectivity from Freetown. I have the pleasure to read out the statement. Yeah.
Can you continue, please?
Thank you. Excellency João Ribeiro de Almeida, President of Camões, Excellency Pekka Haavisto, Minister of Foreign Affairs of Finland, Excellencies Ministers from G7+ countries, invited speakers, Excellency Carlos Xanana Guzmão, eminent person of G7+, Excellency David Cameron, co-chair of the Council on State Fragility, Excellency Dr. Luis Amado, Chairman of Supervisor of EDP Group of Company, distinguished ladies and gentlemen. A very good morning from Freetown, Sierra Leone. I hope you and your loved ones are safe and healthy. At the outset, I'd like to welcome you all to the second conference on state fragility, pandemics, vaccination, and solidarity, implications in fragile countries. I thank the G7+ Secretariat and Clube of Lisbon for organizing this conference, the theme of which speaks to the heart of overcoming the crisis the world is going through. Ladies and gentlemen, COVID-19, by several measures, is the unprecedented crisis of our generation. Our course humanity had gone through even worse man-made and natural calamities of the history. But this pandemic affected us in a unique way. It befell on us on time where the world is much progressed on every front that is during the past time pandemics. The blessing of scientific advancement has made such crises an uncontrollable challenges. The globalization is often cited to be responsible for this rapid spread of coronavirus, has made such crises even manageable. Regional and global integration and partnership models have empowered us to curb such catastrophes more effectively and efficiently than we would ever do in history. Multilateralism has equipped us to overcome challenges of society, even severer than the pandemic. Had we harnessed the blessing of science, globalization, multilateralism, and cooperation, coronavirus would not have even turned into a pandemic. Therefore, the most pressing questions we ought to answer are: why the world faced in curbing the pandemic, which is now in its second year? How severe and how long will its impact last? What has been missing in the global response to the pandemic? How can we ensure we come out of this crisis all at once? How confident are we that no one will be left behind? This conference is an important opportunity to explore answers to answer these questions. Excellencies, distinguished ladies and gentlemen, however global the pandemic is, conflict-affected countries, such as those in the G7+, are the worst impacted by its immediate and long-term direct and indirect consequences. Owing to our institutional and economic fragility and long-lasting ongoing conflicts, our countries are prone to an adverse impact of such crises. Our countries have been so vulnerable that even the globally adapted countermeasures started to worsen the situation. Considering these multifaceted effects, the G7+ issued a joint call last year with 4 big asks, namely ceasefire, cease for displaced people, care for displaced people, strengthening health system, and support for institutions and self-reliance. Against this background, I'd like to leave you with a few points that might be food for thought in the sessions of this conference. First, we cannot defeat the virus, our common enemy, until we overcome our difference at any level. First and foremost, we need to do everything to stop wars anywhere. We need to use all tracks of diplomacy to pursue global ceasefire and reconciliation. The UN which should establish a high-level council to facilitate dialogue and reconciliation. The G7+ is willing to cooperate in this regard by lending our experience. Second, multilateralism is the only vehicle that can help in overcoming any shared challenge such as COVID-19 and its long-lasting impacts. We can call upon the United Nations to take the lead in the global response to the pandemic. We urge regional organizations such as European Union, African Union, ASEAN, and etc. to cooperate and adapt regional policies and can act as a catalyst to overcome the impact of COVID-19. Third, we welcome the initiative of COVAX. Furthermore, we are happy to hear the recent commitments made during the G7 meeting. However, we need of vaccination over the long run available supply. In addition, we are concerned with preferential treatment in immunization. In particular, poor countries, such as those in G7+, are the threat of risk left behind. Therefore, we urge vaccine-producing countries to waive the patent of production of vaccination. This will help us in speeding much-needed vaccination of the world. Remember that no one is safe until everyone is safe. Finally, the COVID-19 pandemic has unleashed the fragility in global systems and mechanisms. The fragile countries have lived for decades. Therefore, we'd like to reiterate the need to help in overcoming state fragility. Fragile countries are relied on foreign assistance for decades. Now is the time to use the assistance in pursuing stability and self-reliance in these countries. This will require adapting paradigm, shifting the way we manage assistance. We urge donors to realize the New Deal principles which are relevant in our countries. I thank you for your attention and we wish you a fruitful deliberation. Thank you.
Podem falar agora à vontade. Corta no YouTube, mete no cartão no YouTube também. Estamos no ar.
We're on air.
Olá, bom dia a todos.
Hello, good morning all. I'd like to thank you all who are watching this conference, in particular those who are here for the second time. President Helena Guzmão, Mr. Moreira da Silva, Luís Amado, unfortunately, underwent surgery, so he can't be with us. And I'd also like to thank Ambassador Wahid YC. President Guzmão is the father of G7+. He's former president, former prime minister of East Timor. Jorge Moreira da Silva is director of development, director of OECD, and former minister of environment of the Portuguese government, and Ambassador Wasi is ambassador of Afghanistan in Canberra, Australia, who kindly accepted the invitation when he knew that, we know that the president of Afghanistan is currently officially visiting the US, and it prevented Andela Ras to be here with us, ambassador and permanent representative of the Afghanistan to the United Nations. We're going to talk about geopolitical and diplomatic impact on the pandemic. We have 4 figures who have been following closely the global movements in last year, but they also have different viewpoints on the impact of the pandemic.
With a practical bit of information to say that we have simultaneous translation in the streaming platform of this conference. So straight Fragility 2021.digital stream.pt. So if you prefer, please join us there. Portanto, acabei de dizer que há uma tradução simultânea.
Well, I've just said that there is simultaneous interpretation on the streaming platform of this conference. So if you will join us on this link. COVID-19 is experienced differently in Lisbon, Paris, Kabul, and Delhi, and Canberra. So we're going to discuss informally as we were all sitting around the table. And so I'd like to ask the members of the panel to make a sign to wave before, if you want to take the floor. The public can also use the chat function to put some questions. I will be reading your questions and messages, and then we'll put some of these questions to the speakers as the discussion will continue. You can put questions right away. You don't have to wait until the end. So I'm going to put the first question, which is very generic, and the same question to all the members of the panel. And we're going to start with the question that the organizations has chosen. But I'm going to divide this question in two. So I'm going to set aside vaccination. We're going to discuss vaccination in a minute. But the main question is, well, the first part of the question is, what has changed in geopolitics and diplomacy during this year of the pandemic? President Shanana, you have the floor. According to our viewpoint, very far from the world, I believe that nothing has particularly changed in terms of fragility, in terms of poverty. What really changed is the threat that the pandemic represents. And it's a threat for the lives of the citizens. In geopolitics, let me say that we really feel the lack of vaccines. I've tried to follow the intervention of Mr. David Cameron, which was an excellent intervention, although the technical issues did not enable us to follow it all because the connection stopped a couple of times on our side. However, he raised many important issues. And the first speaker, Mr. João Almeida, has also raised very important issues. The question here now is, has there been a change?
Não houve em termos de pandemia, não houve. Agravou foi.
So the pandemic didn't change anything, but the pandemic aggravated the situation. It's not really a change, it was an aggravation of a situation of profound crisis in fragile states. This aggravation of the situation makes us think that how much these countries are exposed to an entry of the virus at a large scale. This is why we can only say
quanto ao comunicado que o G7 Plus fez.
In relation to the communique made by G7 made and the Secretary General on a global ceasefire, we've seen that it doesn't produce any effect. In relation to follow
vamos lá dizer, de uma assistência mais eficaz.
A more effective assistance provided to poor countries and fragile countries in combating the pandemic, we haven't seen a very effective action. We have been following the global processes, and as Mr. Cameron said, we understand that, for instance, in Europe, each government tries to solve its own problems. And in fragile countries,
os contactos são mais difíceis.
Contacts are much more difficult.
As pessoas, a afluência de pessoas ou no mercado,
the people who are in the markets and restaurants are very few, because we're very fragile country, so we don't have many economic conditions. So the highest priority of government is to solve the problems in each country first and foremost. Sometimes we say we need more, but in terms of the different realities, we fully understand the biggest concern of European countries in solving their own problems in their respective countries. We've heard the news that we can't vaccinate everybody because there have been some failures in vaccine supply. If this is in Europe, where vaccines are produced and can be distributed across the different European countries, for us, fragile countries, very poor countries, the question is even much more difficult. So, when we think about diplomacy, when you think about geopolitics, once in a conference with Japan, I have appealed to governments, to the great powers, to understand the global dimension of the pandemic. Some years ago, we faced the problem of Ebola. It was very regional. It was a very regional crisis, but this is not the case today. The pandemic is now global. In this respect, I believe that the United Nations itself and other organizations such as the European Union and other organizations, if they could join efforts, as Mr. Cameron said quite rightly, so that they could share the expertise, share technology, it would be great. Otherwise, we think, well, it's Pfizer, Moderna, Johnson & Johnson, they're all these vaccines are currently competing. So, the problem is going to affect us greatly, us, poor countries. The third world, if we still could use this term, it's going to affect us greatly. If there were resource sharing, knowledge and technology sharing, I believe that we could do things differently because this has got a global dimension. Let me, if you allow me to interrupt you, picking up your word sharing, do you believe that wealthy countries are sharing as they should? Or do you see that there is great selfishness of the West, ignoring poor countries? I don't mean the West as a whole, but those countries who produce these vaccines, if they had realized the global dimension of the pandemic, at the United Nations levels, all the scientists could sit together and say, let's produce a global vaccine to face this global pandemic. So I would say that we all know that is global. But all the countries know that it is a global pandemic, right? Yes, it is global, sure. Let's talk about Delta variant. If it weren't global, Delta variant would only be in India, so only the Indians would have to cope with the Delta variant. In South Africa variant or the UK variants. So this is a problem. Why do they close airports to Brazilians, for instance? Because there is a new variant in Brazil. In our world, in the so-called third world, there is a concern. We are looking at news and we hear AstraZeneca above this age group, and then there are problems. And we've had some individuals who suffered some adverse effects with AstraZeneca vaccine, and everybody was afraid. And we discussed whether Johnson & Johnson is better or Moderna, because we, third world countries, to simplify, we fragile countries, we are very much astonished how we're going to purchase these vaccines when we hear sharing technology, resources, and scientific knowledge, and this sharing is not taking place. So, for instance, you talked about selfishness, but we think we are competing. The biggest problem of competition is income, and in this case, this should not be. So if world leaders and United Nations would say we pay, not in terms of purchase, but we pay for the costs, the production costs of vaccines, and we distribute vaccines for the whole world, I believe that this global perception of the problem would be truly effective. Now it's been 2 years, right? So, and in particular in Lisbon, Lisbon is now on a red list. There's been a wide reaction when the UK placed on the red list. What does it mean? We are looking at the developed world, their own problems, and we look at ourselves and we think, well, we fragile countries say, we don't have even money to buy food, even less so to travel to Europe. The big problem is if these new variants are coming to our country, we're all very much afflicted. If we think about this every day, if we all think like this in each country, so David Cameron said that only 2% have received the first vaccine in Africa, whereas in the UK more than 60% have received the 2 doses of the vaccine. So this is the issue. So I'd like to take advantage before passing the floor to Ms. Moreira da Silva. So what is the vaccination plan in East Timor, the more optimistic plan for vaccination? What are the deadlines for vaccination? We have already started vaccination. We already have people with 2 doses of AstraZeneca. Our society was a bit mistrusting because some people are suffering from the adverse effects of this vaccination. I'm not going to defend this vaccine, but the Prime Minister of Portugal also took AstraZeneca. Millions of people did. Here on the head office of G7+, we've all been vaccinated with AstraZeneca. But it creates a sort of fear, a sort of mistrust. So China sent hundreds of thousands of vaccines, and so others are also being vaccinated. We have a very small population, under 1.5 million. If we had a greater capability in terms of our own resources and in terms of technical capabilities, in a short period of time, we could vaccinate all the people. So you rather have vaccines for the whole population? No. Last year, I've crossed all the country to call the attention of the people for the fact that we didn't have yet COVID-19, but COVID could be important. So it created conditions for the fact that we don't have many cases. The first speaker, he said quite rightly, and if we look at our reality, I can imagine the reality of other countries, particularly in Africa. Technical support for making tests and treatments. If we really want to combat the situation in poor countries, you should vaccinate, but we also have a great need of technical support from abroad to make tests and for treatment of patients. Our own problem here, we know the news of the world, but so, for instance, we hear about increase of cases. So people are isolated for 2 weeks and they are not treated, and they say, well, you already cured. And the population doesn't know how to read or write, but they think, how, without a treatment, how can they be cured? It's just going to be in isolation for a couple of weeks. So I like to look further away and imagine our brothers and sisters in Africa, in very poor and fragile countries, and very much affected by the pandemic. How are they going to cope? But one of the problems is the lack of information, rise, because technical knowledge, but also general information, because most people don't have to go to hospital. They stay at home for a couple of weeks. No, this is the problem, really. When we test, we make a test, you say, I'm positive. No, I'm not, because I'm not sick. You have symptoms, and then you know that you're positive, but sometimes if you test positive but you don't feel sick, you make a swab test, you don't have experts to really analyze it properly, so they tell people go to lockdown. But in several regions of countries, you go to lockdown, they all go into the same room, they all sleep in the same room for a couple of weeks, and so they were not sick, so they don't believe that they were already cured. So this is why society does not believe in this process. Okay, thank you very much. Thank you very much. I'm passing the floor to Mr. Moreira da Silva.
Transporto este problema para os outros países frágeis.
So this problem probably happens in other fragile countries. The problem that we're living in relation to test vaccination, I believe that this is also taking place in other fragile states. Thank you. Mr. Moreira da Silva, going back to our starting point. So what is the impact of the pandemic in geopolitics? What really changed in diplomacy? So I'm going to leave vaccination into the second part. It's a great pleasure to be with you, Barbara, with the Ambassador Valle, President Shanana, in the second session organized by the Lisbon Club and G7+. As you know, I'm in the area of development cooperation in OECD and basically responsible for evaluating the efforts of wealthy countries to support developing countries. As you know, we have some work done in the area of fragility. We publish every year the report on states of fragility, and we work quite closely with G7+. What can we see in terms of development cooperation as a consequence of the pandemic? What President Shanane was saying, this pandemic has affected all countries, all citizens, in an unequal and disproportionate way, developing countries, and in particular those in context of fragility. So there is a problem in false symmetry. So the normal citizen believe that we are all suffering the same way, but this is not true. Those countries which were lagging behind us even more so, and there are figures which show us that we have 4 successive waves of poverty and inequality caused by the pandemic. The first wave was the lack of the most fragile states to test and for social distancing. For this first phase of the pandemic, where oxygen was required, intensive care units were required, social distancing. But to talk about social distancing in oversized cities with over-occupation, without good health conditions, where there is even drinking water, it's not possible for distance learning or teleworking to take place. This is mere science fiction. So there was a first phase, was the first reaction to the pandemic, social distancing and testing, and somehow mitigation of the pandemic effects were disproportionate. They were even more damaging for the most fragile states. Everything that international institutions said as recommendations to fight the pandemic was could only be put in practice by wealthy countries. For instance, if we think about the shanty towns or cities of huge poverty, can you really talk about social distancing when whole families live in the same household? It's not possible to work from home. Working from home is a luxury. Distance learning is a luxury. So there's been this idea at the beginning that we're all in the same boat, but this is not true. We were never on the same boat. And the most fragile countries never had the same conditions as we did to put a stop to the pandemic on the initial stage. It was a second wave, which was poverty and inequalities, and the figures are quite eloquent. 150 million people into extreme poverty right in 2020, and we now expect that 50 more million will be into extreme poverty. Inequalities within countries and between countries have significantly worsened, and in those countries, context of fragility, in the 57 fragile states, 2 out of 5 people are now in extreme poverty and will be so in the near future. So this is a double of what are the effects in developing countries. So the fragile context, if all developing countries are affected, the 57 countries which are in fragility context are even more affected. There's been within this wave of inequalities and poverty, the financial flows had an impact. I'm going to share a couple of figures, which I believe are quite eloquent and speak for the unequal world which has been created on the initial impact of the pandemic. Foreign trade fell around 8%. The migrants' remittances, which are an essential source for poorest countries, the money immigrants sent to their families, has fallen 20%. Foreign direct investment has fallen 13%. Tourism, in particular in these small island states, you know, President Chanel, you know this, in East Timor, the tourism, which one the essential factors for development of the economy, representing 20% of GDP in many of these small island states, has practically stopped. There has been a fall of around 70% at global level, and the only financial flow which was resilient, and this is a very positive sign, although insufficient, it was foreign aid for development, which increased 13.5%, it was against the cycle, or it was counter-cycling. It increased $2 billion from 2019 to 2020, but this is a small drop in the ocean. Now, currently, we have 161 billion, but this is a small drop in the global financial flow, which have broadly fallen. How much has it fallen? Adding up, do you remember, Barbara, we used to talk about the SDG financing gap? So this SDG financing, $2.5 trillion, and this gap has increased to $3.7 trillion. So in only 1 year, it has increased 50% the SDGs funding gap for the poorest countries. And there's been a third wave of inequality, and again to discuss it later on, which is vaccination, the unequal access to vaccination. And there is a fourth wave, which is economic recovery. Our countries, northern countries, are talking about recovery and resilience packages, financial stimulus, but the wealthy countries have mobilized $16 trillion of financial flows. $16 trillion. So it was a remarkable mobilization, fund mobilization, in view of such a social and economic crisis affecting all. Wealthy countries have mobilized $16 trillion. But look at this disproportion. Foreign aid to development has increased $8 billion. It's 2,000 times less than the sum of the financial flows that wealthy countries have created to relaunch their own economies. We still have COVAX, which lacks $2.8 billion this year for vaccination. So we have a problem, not just in the first phase of the impact of the disease, also aggravation of poverty and inequalities, then in unequal access to vaccination, but also on the recovery, economic recovery stage, where the disproportion of means is extremely high. But to conclude, let me talk about two positive signs arising from this pandemic. A clearer idea of the interdependency amongst all countries. I believe that today we all realize that we're all connected, and it's not possible to deal with the global problem at a national level. If we lag behind in vaccinating poor countries, for instance, this is going to have a negative impact on global economy of $5 trillion. Half of this effect will be felt in wealthy countries. So when we lag behind in vaccinating poor countries, we are failing morally and ethically, but also being irrational economically speaking, because there is no recovery of global economy while there is no vaccination in developing countries. And this notion of interdependency is quite positive. Is this notion is real or theoretical? It's very clear what you just said, but in practice, what this is what we're seeing in practice. Yes, we are seeing this in something which is compatible with our perception, but in fact, citizens are rather aware of this. Who we deal with corporations, sometimes we talk amongst us. It's a group of experts, let's say, but now for the first time ever, this is much more than live aid. Live aid was very small compared with what we have in front of us for the first time ever. We have the common citizen realizing that if we do not show solidarity with developing countries, the pandemic crisis and social and economic crisis won't be stopped. This is very important because the voters, the taxpayers, have now a full, a more complete idea of interdependence. And we know that global architecture is changing. I do not recall any global crisis which has not generating or created new global institutions or a redefinition of global architecture. Global architecture is changing, and we can see this with the creation of COVAX, which overnight has united almost 200 countries, with the ACT accelerator, which has mobilized efforts from different countries for testing, health infrastructures and vaccination. G20 and G7 started taking measures that we didn't believe were possible. For instance, G20, for instance, in a week has advanced to the suspension of the debt service to poor countries. It's been an insufficient step. We need more than this suspension of the debt service. We need the restructuring and the debt relief. It's a very positive step, given at the beginning. And G7 a couple of days ago has also taken very important positions in vaccination, in financing, and in climate neutrality, carbon neutrality. So I believe that this notion of interdependency is making global leaders, in particular amongst the wealthiest countries, to come out of their comfort zone and realize that they have to be more ambitious. They have to show greater solidarity in supporting poor countries. Well, I conclude my observations for the time being. Well, before passing the floor to Ambassador, isn't there a contradiction? I believe that you have to convey an optimistic message because you represent an organization which is where we really supposed to give an inspiring message, but this staggering number of 2,000 times less than this, what you've aid in development aid and what the wealthy countries have mobilized as funds for themselves for their recovery, 2,000 times less. It's a staggering figure. It sounds a big contradiction in relation to all what you said in the second part, saying that you see that there is this pedagogical effect. Everybody's now realizing that interdependency is now the rule and that the global architecture is changing. Well, it's not really changing a great deal, or at least it's changing very slowly. Yes, I fully agree. Please don't take my words wrongly. What I'm saying is that citizens already realize that we're interdependent. It's the right time for leaders to accelerate this cooperation and solidarity, because what we've done during the pandemic is going to be a fundamental lesson for the climate crisis, which is going to be even much worse, because climate change, well, the climate is not solved by social distancing or teleworking. We're going to deal with these consequences according to what we do now and what we have done so far. So the crisis has aggravated inequalities in poverty. The crisis is unequal. The response is not compatible with what was needed. But still, let's pick up this notion that citizens are more aware of interdependency to increase historically the aid for development, but not only, but also the private investment. This is a right time for private investment to go to fragile states. Public aid will never solve everything we need. We need $3.7 trillion in financing gap. The public aid is 161 billion. Even if the public aid would double, treble, would increase up to trillions, it will never be enough. So we also need the private sector, the financial sector, to understand this message of interdependence, because if they don't do it, the consequences are going to be much worse. So basically what I'm saying, this is not just altruism or ethics. What we do not do today will have even a worse effect in global economy. To leave vaccination to be concluded in wealthy countries in 2021 and only be concluded in 2024 in the poor countries is going to have an effect of $5 trillion in world economy. So what we are telling wealthy countries, this is what we do, because wealthy countries are our constituencies, are the shareholders of OECD. What I'm saying every day is not only for ethical reasons, but also for their own interests, for the recovery of the global economy. No hesitation is now, no hesitation is now due. So for the first time in many years, this narrative of international cooperation and international solidarity is something that the citizens in wealthier countries understand. When a wealthy country and decides to cut aid for development or not increase development aid and looking at its own interests, this is a narrative which is not in line with what citizens expect. So citizens and politicians in particular, which are very attentive to the cries of the common citizens. The common citizens want more vaccines for the poor countries. I believe that Mr. Tedros, the Director General of WHO, said everything. We are in view of a serious moral failure to vaccinate healthy people, young people in wealthy countries before vaccinating over 80 people, health professionals and vulnerable groups in developing countries. This is a serious moral failure. So this should not have happened. We should not vaccinate the people in our countries first and then all the others afterwards. The vaccination should have been approached at a global level, vaccinating globally the elderly, the most fragile, health professionals, and then gradually vaccinating the younger people. This is a mistake that has already taken place. So now that this error has been made, not considering vaccination the global viewpoint, but looking at it on the national viewpoint, but also complemented with the global dimension, at least, well, we now see that this error has been made. Let us quickly speed up the vaccination of the poor countries. I know that Barbara would like to leave this for the second stage, but this is something I'd like to say right away. Ambassador YC, I'm going to put the same generic questions at the beginning of this discussion. What is the impact of this pandemic in geopolitics and diplomacy? But I'd like to take advantage of picking up the words of Mr. Da Silva and asking, do you see this in Afghanistan and in the region of the world which you are more closely related to? Do you agree with this idea that the citizens during the pandemic know a great deal about this, rather more than the politicians?
Não estamos a ouvir, embaixador.
Fred, you are muted, Ambassador.
Yes.
Thank you, Barbara. I'm really pleased to be here with you, especially with eminent person Shanana Guzmão, George Moreira, and colleagues who are from the G7 Plus Secretariat. Let me touch upon what you already mentioned about the generic question about geopolitics and diplomacy. The coronavirus has already contributed to larger global geopolitical deterioration. It may not have been a game changer, but the virus certainly accelerated the ongoing negative trend toward a more polarized and fragmented world. Therefore, the coronavirus crisis has proven that in a highly interdependent world, as Jörg was mentioning, and ensuring public health is not only a national interest, but also a global common cause. as its nature unveils that the virus hits hard the most vulnerable persons with health condition. The pandemic has hardly hit the developing countries and in particular conflict-affected countries which are already in a fragile situation. The impact, whatever it is, might even be severe on landlocked countries such as Afghanistan. The vaccine diplomacy has already found a place in the overall general terminologies of world politics. Unfortunately, we have already witnessed that vaccines have been used as a tool to advance the geopolitical aims, strategic competitions in the world, and many other issues around global diplomacy. Several, if not most of the conflict-affected countries have geographical significance, which is mostly responsible for their existing conflicts and hence fragility. As an example, Afghanistan has been at the crossroads of civilization for decades, for centuries. Trade and great powers struggle for hegemony. Great powers have used ideologies as tools to advance their respective spheres of influence. Even our current crisis and the result of the geopolitical struggles among the regional and global powers. The onset of the COVID-19 and the immunization efforts, as you mentioned, Barbara, have added to the layers of complexity of our crisis. But I would like to summarize this on a positive note that the pandemic is a universal challenge now. And as colleagues mentioned, since no one is safe until everyone is safe, I hope that diplomacy will focus on curbing the coronavirus that knows no borders and no economic and social mind. Back to interdependency, then, can be exploited to advance the collective well-being of humanity. This will very much depend on the decision made by the more powerful nations of the world, who are the main producer of the vaccine.
Just as a follow-up of that idea of the citizens being ahead of the politicians. Oh, I'm sorry, I'm supposed to speak in Portuguese. I beg your pardon.
It's okay.
Well, but that is a question, whether you agree or whether you see that. Se vê isso acontecer.
Do you see this happening in Afghanistan?
It was translation was half translation. Can you repeat, please?
My fault. Eu peço desculpa.
I'm really sorry. I'd like to ask if you agree and if you see any signs in your country, Afghanistan, that citizens have a better knowledge, more aware than politicians in relation to the need or to this idea of interdependency between the countries?
As I mentioned, Afghanistan is a landlocked country. The people already is struggling, and in terms of trade, market access, roads and transportation, the countries and the population in landlocked countries are more vigilant and more alerted than the population and more seaport countries or those who have better connection with the world. This makes them to be more cautious about the issues around these global crises. However, it is not basically a matter of, especially at least in our case, not matter of the citizen and politician, It is more about the lack of the supply, which contributes to some more inequality, and also the escalation of insecurity in Afghanistan that really contributes to lack of access to health facilities and so many other problems that comes out of the conflicts. These are preliminary issues and main issues that contributes to that sort of linkage between government, citizens, and also the overall notion of services to public.
And before I move on antes de eu dar a palavra ao...
Before giving the floor to President Chanana, how is the vaccination plan in Afghanistan? What can you tell us in terms of timing of the vaccination plan?
The vaccination in Afghanistan is already started, but not in a way that it should have, comparing to regional countries or countries with advanced situation. Conflict has been increased after the Taliban really broke their vow in terms of the deal they made with the United States to reduce the violence, to immediate ceasefire, and end the conflict. But since these are broken, the insecurity really contributed to the distribution, and at the same time, conflict really keeps all focus, shifts focus from reaching to public in terms of overall services to some other priorities. However, the vaccination and COVID is really the major priority. But so far, we managed to have vaccines to less than 2% of our population. So this is really low level. The vaccines are coming from India, China, United States, and there are other international partners who are contributing throughout their international package, ODA packages to Afghanistan, and those are coming through international organizations who are responsible for supply and distribution. So so far, this is the overall story of vaccine in Afghanistan. However, again, since conflict escalated in different parts of the country, we faced a large surge of displacement, population displacement, one place to another place. And also, the Taliban increased targeted killing of for example, vaccinators and medical health officers and officials, and those who are in public health. They are also damaging and the health facilities, which they are in.
So Taliban is killing the nurses who are vaccinating the citizens?
Yes, at least 3 cases, 3 group killing of targeted killing of the nurses who were doing a vaccination. Actually, the vaccinators were doing a polio vaccination, but it seems that it looks like, since they are target, it makes very difficult for those officers or officials to really go to the next level of vaccination if it comes in terms of COVID. So unfortunately, this has been recorded and during past 3 months in Afghanistan.
Okay, thank you so much. Muito obrigada.
Thank you. President Chanana, I read in the G7 Plus document about solidarity and cooperation, an appeal you made to a joint effort to stop the pandemic. And one of the interesting aspects I've read about was this idea that the countries in fragile contexts have experience in crisis management in the different levels, because they know very well, they know better than anybody else how to face this serious crisis. For a long time now, they have this accumulated experience of how to face crisis at different levels. So in practice, what does this mean? You say in the text that could be used in the global combat against pandemic. What does it mean, this practice, this sort of experience? How can you use this experience, this practical experience of the most fragile countries? In practice, it means, as you said, and Mr. Cameron said, normally, I really respect Mr. De Silva from OECD, but the big problem before the pandemic, and now, of course, clearly it is now become aggravated. The biggest problem is the imposition of plans and programs by donors, where there should be a great coordination and collaboration with local governments. Of course, there are different aspects. A country's reality is different from another country's situation. However, given that the pandemic has a global dimension and the threat is felt by all, the experience that G7 Plus can provide is a better exchange of views or better cooperation and figuring out solutions specific for one region and another region, because G7 Plus, you know, we have OECD is a member and we have many other members, so we can't solve all the problems, but in certain countries and in certain regions, we can provide an experience of a better contacts established. And also, as Mr. Cameron said, if we could take advantage of this dialogue, if we could, if the West, if developed countries could provide a possibility of a local vaccine production, it would be great. In Europe, for instance, the distribution of vaccines can have some problems in terms of postponing, in terms of insufficient production, which does not meet the needs. Mr. David Cameron said quite rightly, of short, medium, and long term. Because we can't think that the pandemic is over by the end of the year. We have to think about the situation as how to look at the situation in poor countries or fragile countries. And you have to combat this pandemic within a longer period of time. So this ability to establish dialogue and cooperation can be used as a condition to communicate with OECD countries and Western countries so as to find a way to build the capacity of a region and allow for the production and supply of vaccines. Otherwise, you can't get there. If in Europe itself there is lack of vaccines, we can't imagine that it will be easy to do the same in African countries or in other regions of the world. President Janana is a politician for many years now, with official in office, let's say 20 years. You've met many prime ministers from Western countries, and you have met them publicly, and you have also heard many former prime ministers talk with you, and also publicly. I see you quoting former Prime Minister Mr. Cameron, and my question is, so I think it's very easy to say these things which are a bit more idealistic about the problems are solved when you rot a government, right? Which is the case of Mr. Cameron. Of course, that's right. That's so right. When I was Prime Minister, now I have a different view. He's also confessed the same. But this statement about the needs of fragile states was magnificent in many aspects. He didn't address us as former Prime Minister, he addressed us as the co-chair of the Council on State Fragility, which is different. So he's in his role as co-chair of the Council of State Fragility, yes. So in fact, he spoke in this new role. Now, putting together pandemic and vaccination, although we have mentioned your views on vaccination, can you, President Janana, can you draw two or three big lessons that the pandemic is giving the world? Firstly, if we look at the world, at the beginning, I didn't want to believe about this, and I said, well, this is a problem of somebody else, it's not our problem. Initially, there's been a very negative reaction when the COVID-19 appeared. So instead of all leaders was starting to think how to solve this, they were on the blame game. But then there was a stage when in Europe itself, when in fact the pandemic was truly invasive, Europe started realizing that it was a serious problem on the third stage in terms of chronology of the pandemic. Now, the third stage, there was a big competition between vaccine manufacturers, and this competition did not produce any strategic or global strategic goals, because in Europe was just the beginning. You always have the good side and the bad side. we can't say that any action is only negative or only positive. There's always the upside and the downside. But people suddenly realize that a vaccine is better than other, and so on and so forth. But the downside in global terms was the fact that the world leaders did not realize and did not require, did not ask scientists and vaccine manufacturers to sit together to produce vaccines for the whole world, so that everybody, the whole world, will trust in this global vaccine, because this competition between the United States and other regions, well, this, in my view, has delayed this combat of the pandemic. Now we talk about needs. Today, Mr. De Silva talked about a notion of interdependency, and I believe that's the case. I agree. When we have this notion of interdependency, we can't believe that it will immediately have effect, but at the same time, the President of the United States, Mr. President Biden, went to the EU, and in meeting with the UK and the European Commission talks about millions of doses for poor countries. So there's already this notion, but it will require some time to be translated into concrete and grandiose steps, if you allow me saying so. Earlier on, you mentioned, we've talked a couple of times about foreign aid, and also associated to independency. For many years, NGOs for development, NGOs and fragile countries, they ask for better partnerships. They require partnerships where the assessment does not depend on immediate outcomes, which, as the President said, partnerships where the voice of those on the receiving end should be listened to. President China, do you believe that the pandemic is going to change these sorts of partnerships for development? Do you believe we're going to have a stronger voice? It may be the case. It may be a condition for change. A condition for a change of mentalities. G7 Plus believes that the money we receive comes from the pockets of the taxpayers. So this is why we always tell donors this money shouldn't have come along with its own programs. You should make our programs based upon our own programs, because if you give them your own programs, you will not help us. And in G7 Plus, on G7 Plus, I contact with several countries with conflicts, and we reached the conclusion that United Nations feel they are sustainable when there are conflicts. The sustainability of many organizations in the United Nations is provided by the continuation of conflicts, for instance, in the Central African Republic. I went there twice or 3 times. There were times when there was a peacekeeping mission and there was never peace. So what they were doing, what were they keeping? They were not keeping the peace. In that case, there was no social distancing. There was a distancing between the organizations, the peacekeeping mission, and war tanks in the middle of the cities. And there was war and shooting and conflicts in the rest of the country, because there were some economic interests of some countries which feed into this rebellion, and certain groups took advantage of this. In this respect, I believe that this mentality of going to a country and imposing amounts, cultures, ways of doing is something that we in G7 Plus always repeat. We have to respect values, have to respect identities. So this is why there is a bigger closeness, and Mr. Cameron said quite rightly, we have to correct our approaches. I can't resist, but I'm very surprised with the way you have reduced United Nations. That we know. But the question is, would East Timor be independent without the United Nations? Yes, we have here, as you have in many other places, the Organization for Refugees, that we don't have refugees, but they're here every day receiving money. But why? Why? The current Secretary General of the United Nations in its second mandate said, no more reports, more results. Because we are used to this, and this is a topic for discussion in G7 plus countries, because organizations come here, they receive money, they drive around, and they make reports. But, they talk to people and they make reports, there are no results. This is why I commend Mr. Guterres, and I hope that he will perform a very good second mandate, because no more reports, please, more results, right? So the money which is currently being spent is taxpayers' money. So you're saying that you currently have in Delhi an office of the United Nations, USCR, not just here, but everywhere. They do nothing. They do nothing, but what we need is concrete things that, concrete things they can do. I really quote David Cameron because we have, because he made a very good intervention. If it would only a former prime minister, now no, we can trust his vision and his policies. So I asked Mr. Moreira Silva, how do you see the future of partnerships after what President Xanana just said? My question is, do you agree, using President Xanana's expression, that the programs of the organizations is not helpful. Do you anticipate any change in the way of building North-South partnerships, as people have been asking for many, many years? Thank you. I believe that this is a moment where the efficacy of development aid is going to gain a new momentum. You know, the Paris declarations had the idea of a global partnership on effective global cooperation, the country ownership idea, the development aid are dependent on the interests of the developing countries, the focus on results, transparency, and partnerships. Well, we now have to take advantage of this crisis. I mean, we never wish for a crisis, but the crisis should be considered as an opportunity to speed up some of the agendas. I agree with President Shannon. This is the time where we cannot just look at the expenses and be more focused on the impact of what we spend. There is a risk, and I'd like to talk about risks. The risks are, because we're now mobilizing more resources of United Nations, bilateral aid, private sector into developing countries, there is the risk of the political leaders of the donor countries are being pressurized to spend and spend quickly. Now that there are additional resources being mobilized, there is a risk of all of a sudden you have to spend rapidly, and it doesn't necessarily mean to spend in the most fragile states in the best, in the riskier context, and in those social sectors such as health and education. So we run the risk of investing essential in infrastructures, which is where the private sector is mostly interested in, and in the middle-income countries, MICs, and not the LICs, or in fragile contexts. So the rationale cannot be follow the money. The rationale has to be on the impact. There's only a way of increasing partnerships. There must be a more transparent, more cooperative way in the dialogue between donors and developing countries. Obviously, taxpayers of the donor countries also want to see results, as the citizens in developing countries want to see results of the policies, but the donor countries or the taxpayers of the donor countries put huge pressure on the donor countries and their agencies to deliver results. And I know no other way, and I've been a politician myself, I know no other way of guaranteeing results. And at the same time guaranteeing the ownership of our voters and taxpayers in development aid that does not imply cooperation or partnership. So this is a real important moment to strengthen partnerships. Secondly, conflicts. Conflicts deserve a particular concern. There's been a greater correlation between fragility and conflicts. In 2010, 60% of the fragile states were living in conflicts. We now have 76% living in conflicts. So there is a greater correlation between fragility and conflicts. Conflicts did not decrease during the pandemic. It's very important not to mix up what we read on the media, which is the concern with conflicts has been replaced by concerns with the pandemic. Let us not take what is visible for what is real, because conflicts are still there, or they are even escalated. So there is a risk of 13 countries to start conflicts in the next 2 years, in accordance with some studies. And also the correlation between food insecurity and fragility, such as Yemen. Yemen is living in a tragic situation of conflict, and 1 out of 5 children suffer with malnutrition. So this idea, like Somalia some years ago, but both Somalia and Liberia are good examples of international partnerships, of a fruitful dialogue between donors and G7 plus countries. So we have a couple of good illustrations of how partnerships are essential. What I like to say about conflicts, and I've mentioned this in the last conversation about 1 year ago, is prevention. Our prevention agenda. We can't mix up urgency with the humanitarian aid and fragility with crisis response. We have to look beyond firefighting. We have to look at the profound roots of fragility, and the figures are not positive, unfortunately. It is positive that part of development aid is addressing the 50 fragile states who have some $1 billion to help fragile states, but only 2% of this amount is on to conflict prevention. Only 10% of this amount addresses peace building. So more development aid is being channeled to fragile states, but it's mostly humanitarian aid, emergency aid, and not so much crisis prevention or a development aid. Besides partnership between donors and developing countries, there is another side, which is coordination, partnership, humanitarian aid, development aid, and peace. What we call the humanitarian development piece, which has a new OECD recommendation, has to inspire us to have a better coordination in planning, funding, and implementation of humanitarian aid, peace, and development aid. We still have excessive fragmentation, too much competition between these three areas.
Não sei se hoje acordei mais pessimista.
Maybe I have woken up a bit more pessimistic than I usually am, but there is a sort of inability that we've been seeing across the years of making the change. Mr. Guterres started his mandate saying precisely this, stressing the importance of dedicating time and money in prevention, and nothing has changed. Probably the Secretary General, all the former Secretary Generals have been saying this since the United Nations was created. I believe that we're all been saying the same, and here we are 70 years later after the creation of the United Nations, and prevention is a sort of inability to assimilate this idea that working on prevention, you prevent many problems. What we have to change, do you believe? Isn't this an utopia? I believe that, I know that President Chanel would like to say a few words about this. Let me say, for the first time, donor countries are going to be assessed on coordination between humanitarian development aid and peace building and peace maintenance when we make a country evaluation, the so-called peer reviews. This is what established the ranking of countries, and a good assessment or bad assessment. We still didn't have a way of measuring this cooperation. Starting last year, when we approved this new OECD recommendation, for the first time, countries are going to be assessed in the way they coordinate humanitarian development aid and peace building and peace maintenance. I believe that this is going to oblige different capitals, London, Paris, Lisbon, and Washington, and others, to guarantee that instead of having competing agencies and ministries that do not talk to one another, who compete with the relations with developing countries, there will be a greater coordination. But on the field, the same time of assessment is required. So I believe that we're going to have more incentives which go beyond the narrative, because the narrative has not worked. I agree. The narrative did not work. And now we have the tool. And for the first time, we're going to assess countries in terms of the coherence of their policies. President, and I would like to say something on this issue of collaboration or prevention. One thing is prevention, the different thing is conflict resolution. In conflict resolution, as the ambassador said quite rightly, there are internal problems which have not been taken on board. So there is a need to for countries which are great powers to look at this problem. I'm not just talking about Afghanistan, I'm talking about Yemen, for instance. The Yemenites are suffering because of different factions. It's so difficult. So I just like to recall, and I agree with Mr. De Silva, that's very good that we're now understanding, and the OECD has already understood and is trying to put it into practice. Now it's up to us, G7 plus, to respond to this expectation. When we talked about fragility, we talked about political fragility in terms of state building. When we say state building is the presidency, parliament, government, the judicial system, constitution, democratic rights, this is state building. Or if there is already state building, there is the fragility of the economies. In this way, there has to be a combination of efforts to understand each specific reality for each country. And sometimes we want peace, but there is no money. And instead of thinking of giving lots of money, I have several examples of this situation in Africa. You should give credits to the private sector to initiate something, to start something, because the population at large democratic or non-democratic, well, what we really care about is their survival. But after we proclaiming democracy and the importance of human rights, and the population doesn't receive anything as a result of this democracy, they say, well, I don't care about these principles or values. So there is a combination of efforts to understand what the population feels. For instance, Guinea-Bissau. We have taken Guinea-Bissau as an example of the determination, like, for instance, in our self-determination against Indonesia, because we believe at the time if a small country could resist the colonial powers of Portugal, it is possible for us. But then after 2014, I realized that there were serious problems in Guinea-Bissau, and I went there, and there were no state institutions. So this is what fragility is all about. I talked with the population, and they just said, well, we don't care about this one, we just want food. We just want to make money to feed our families. So all this population became uninterested. If we understand the intrinsic realities of each country and their needs, well, then OECD
falou muito bem, vamos buscar
is that looking for other alternatives in terms of participation and cooperation and support.
A fragilidade deve ser
Fragility should be considered in these terms, either the state fragility or the fragility of the economy. In relation to conflicts, they are caused by foreign powers. This is the moment when we say that the world, you know, the big leaders, the big powers have first of all understand they are creating problems. I was invited to a conference in Rome.
Uma conferência sobre food.
On food.
What is
on food and land.
O que é que não existe?
The lack of food of land, and I said we lack peace because refugees going to Europe, they are leaving places where there are conflicts. If there would be this perception that in Africa and Middle East there is a great deal of land to produce food, there would be a prevention of this conflict between the great powers, and Europe would not be receiving these immigrants there. A couple of days ago, some immigrants were drowned near the Canary Islands. It's not because they want to live in Europe, but they just want peace. They want peace in their lives. And they have land. They can grow food. And they have nothing to do with conflicts. They are simply victims of the conflicts. So the problem for conflict resolution has to be dealt with at the level of the great powers and the appropriate measures they create. They create these conflicts. For instance, Libya, suddenly there are conflicts arising in Libya. Well, the topic, well, the role, the responsibility of the wealthy countries in these conflicts would be the topic of another conference. Well, I'm being told that we are about to conclude. So the final question, and I'm passing the floor to Ambassador YC. Well, this is a classical questions of this topic. The question is, has the pandemic decelerated the globalization? So the pandemic is slowed down the globalization. Is it true?
I think as we earlier discussed about interdependency and overall issues of globalization, it really slowed down the globalization. Yes, this is obvious. You can see countries shut their borders. There are so many issues with the airlines. So many people left their jobs, offices are empty. But this is just the beginning. I'm a little bit worried about the future of COVID. I mean, I'm trying to say that if we vaccinate the whole population of the world today, what will be the next? Whether this COVID will be the last COVID of this series? We already read the news about that Delta version is resistance to vaccination. So these are the challenges that we are facing ahead of us, which really deteriorate all efforts that we are putting in and forms of globalization. At the same time, that will also contribute to multipolarization. Multipolarization, now the world is very much multipolar than before. The global powers, if this pandemic is not ending soon, global power could become quite disparate. So that will contribute to a lack of cooperation and different layers, because internal issues are more important than many other issues which is coming in terms of international diplomacy. Health diplomacy is also important in this context. Health diplomacy really changed the narratives of enemies and friends in the world. If this continues, globalization is totally in danger. Or it really contributes to some other polarity which the world may no longer like it. We already seen some shifts in policies and foreign policies of countries. There are new global powers getting together in terms of overall global conflicts and competition, and you can see the reduced role of some other international organizations, which before they had a prominent role in terms of global governance and overall globalization. As Mr. Guzmão mentioned, as well as Mr. Moreira, about the conflicts, that really conflict is something which, if that escalates, as we can see today from Latin America all over to Afghanistan, and even among some other developed countries, the conflict in terms of border closing, lack of trade, complaining to WTO, these are the sort of conflicts, if the COVID pandemic is moving that fast, that may result some more deterioration of the issues around global interconnectivity. But again, my last point is about the future of sustainable development, which was a global case in our overall general global issues. Economic diplomacy and development financing. The future of development financing is in danger. How the OECD countries, for example, how long they continue to support the countries in fragile situation, or the countries and developing need or assistance. How long that may continue if the prevention of COVID is no longer stopping? The prevention of COVID is not really helpful or supportive in terms of vaccination. International peace and security is also something which is getting the biggest effect from these continued pandemic. And of course, multilateralism could be the good solution if we really stick to our globalized sort of mottos and issues that we were working together in the past. So the world in future after COVID should be a different world, a different shift, and overall in terms of this global context. But we really need to be alerted if this continues for longer.
Muito bem, muito obrigada. Jorge Moreira
Thank you
Silva.
very much. Thank you, Mr. Da Silva. There is another question besides the generic questions on the slowing down of globalization and the impact it will have. Also, this issue that Mr. Ambassador has raised, for how long will OECD countries continue to support the most fragile countries? I believe that the two questions are very much connected. I start with the question that Ambassador Valle has raised, which is development finance. We are currently in almost collapse in development finance because development finance is much more than development aid. And I'm particularly worried with this topic of debt, trade, investment, and also tax issues. So there is a pentagon of development finance which has been approached coherently and consistently: development aid, private investment, debt. We had more than a half of the developing countries over-indebtment under before the crisis. Now they are in a tragic situation. Access to trade and taxes, because the resource mobilization is a central issue. So we have to approach this agenda coherently. It is a decisive agenda. Without development of development finance, we will not attain these 16 SDGs. Secondly, global public goods. As Barbara knows, and President Shannon and Ambassador knows, this is a topic which is widely discussed in multilateralism, dealing with global public goods. Now we've seen that resilience to pandemic, the resilience to climate, conflict prevention, managing refugee crisis, cyber terrorism, all questions which are connected to public goods, which should be approached in common, has seen a different reality. And I hope that we'll now can have a improvement of multilateralism, discussing the idea of protecting, regulating, and financing global public goods, where we include forestry, tropical forests, and ocean. There is no other way that on a merely national level, and more so with the pandemic, to deal with local global public goods. It's not something theoretically. And this is the agenda that multilateralism requires. Finally, on the topic of globalization, this is, please, very, very brief. This is a moment where we can't hesitate in relation to globalization. I'm very worried with the idea of some leaders mix up resilience of the global value chains with protectionism. It's true that the pandemic has showed that some of the global value chains are not resilient, and we've had some interruption of these value chains. But the solution is better coordination between countries and more efficiency. It doesn't imply local reindustrialization, neither relocalization or protectionism. We need more global trade. We need better coordination, better resilience of the value chains. We don't need a reindustrialization at all, though that would, in practice, bring more damage to developing countries. Well, this is another topic for another conference, what you just said. So no more questions about this. President Shannon, this is very controversial, what you just said, but President Shannon, you have the final word. I will not take much of your time. I do not really, I'm not an expert in this matter. But what Mr. Da Silva just said brings to my attention the need to learn from the situation. I personally believe that globalization suffers its consequences, and we hope that it will have more positive consequences than the consequence. This is all I can say. Thank you very much. Thank you very much for your words. Thank you so much. I'm really sorry for having taken more than the time we had for this session. I thank all the guest speakers. I'd like to inform you that the next debate will be held at 2 p.m. on the economic impacts of the pandemic in fragile countries. Thank you very much for being here. Thank you all. Thank you very much, President Chena. It's been a great pleasure to see you again. I wish you a rapid recovery to Mr. Luis Amada. Thank you very much, and I hope that next year we can meet in person. I hope so.
Sure. Thank you very much for all support.
Obrigado, Jorge.
0.
Boa tarde a todos, eu sou Ricardo
Good
Alexandre.
afternoon. My name is Ricardo Alexandre. I'm a TSF radio journalist. Welcome to this session. We have simultaneous interpretation on state fragility 2021.statefragility.digitalstreaming.pt. Simultaneous interpretation is in the options at the bottom of the screen. If you have your Zoom app installed in the computer, because the browser version does not have simultaneous interpretation, so please check whether it's the app is already installed.
I'd like to welcome you all to this session of the conference organized by Clube de Lisboa and G7+. First of all, I'd like to remind you that there is simultaneous translation on the following streaming platform, State Fragility 2021.digitalstream.pt. Simultaneous translation is available in the options bar at the bottom of the screen. Please be sure that you have installed the Zoom application on your computer, as the browser version does not have simultaneous interpretation. This said, I'll be moderating this session in Portuguese. Esta sessão incide sobre...
This session will discuss the economic impacts of the pandemic in fragile countries. And obviously, there may be also some discussion on what fragile countries are and what is the state fragility, what are fragile countries, and how these labels are created and given to countries. So can the impact of the pandemic give rise to changes in the development models? If that's the case, what is the role of public and private initiatives, partnerships, donors? We have with us Jorge Thompson Araújo, practice manager for macroeconomics of Latin America and Caribbean from the World Bank. He is in Washington, United States. We have Clara Brandi, head of program Transformation of Economic and Social Systems of the German Development Institute, and she is in Bonn, Germany. Paulo Gomes, co-chair of Afro Champions, chairman of Orango Investment Corporation. He's currently in Abu Dhabi. And unfortunately, for personal reasons, we can't have with us Olivier Kamitatu-Etsu. He's a former head of parliament, former minister of planning of the Democratic Republic of Congo, but unfortunately, he can't attend. We will certainly have him with us in a future opportunity. Let me recall that you can write questions on the Q&A on the YouTube channel and the streaming platform. I'm going to follow the order of the agenda, and I believe it's an alphabetical order, following the surnames of the speakers. So first of all, John Araújo, what is the economic impact of the pandemic in Latin American, Caribbean countries, particularly the poorest countries? Is it possible to have an idea of the impact, for instance, in the GDP of these countries? Thank you very much, Ricardo. Good morning. I hope that you understand my Brazilian Portuguese. I will continue with Brazilian Portuguese. I thank again the invitation to be a part of this very important event. Latin America and Caribbean is one of the most afflicted regions by the pandemic in the world, and is still very much so in extraordinary levels. So 32%, this is the statistics I have, 32% of the cumulative deaths due to COVID-19 have taken place in Latin America and Caribbean. And this had a social and economic impact, which is massive across the region. Latin America is a typically fragile region, according to the definition of what a fragile state is, because most of the countries are middle-income countries. However, there is a level of social fragility which is very high, which has been exacerbated by the pandemic. The economic impact has been huge. The GDP, regional GDP, in 2020 has decreased 6.5% according to our estimate for the region as a whole, which is the biggest recession register in the history of Latin America. And Latin America, as you know, it's a very, it has many recessions, and this has been the worst ever. With a great gap between the countries, each country showed a different decrease of GDP. The case of Panama, for instance, and Barbados, there was an 18% drop in GDP, so 1/5 of the economy has contracted. And in the biggest countries, the decrease has been quite substantive, almost 10% in Argentina, 8% in Mexico, 11% in Peru, Brazil slightly less, 4%, but it was a severe decrease, severe drop. But the most fragile country, which is Haiti, the decrease in 2020 was not as high, 3.3%, maybe because the economy was already in recession in 2019 in Haiti. The economy had dropped 1.7%, mainly because of the political instability. So the impact of the pandemic was a bit smaller. But in general, the impact has truly been very high in the region as a whole. And of course, there was a severe impact on the social gains that Latin America had been able to attain during the last decades, particularly during the boom of commodities, where millions of people have come out of poverty. And there's been now a return to poverty. The progress that had been attained in decades simply crumbled. And this is a situation of great concern for all policymakers in this region. So we are now back to the levels of the 90s of the 20th century. Well, not yet, but the levels we had at the beginning of commodity boom. Of course, it varies a great deal from country to country. In the case of Brazil, for instance, and because of the tax benefits and the fact that Brazil has a very generous emergency aid, in fact, it reduced poverty a bit. And in fact, it improved a bit Latin American averages, but most countries have shown a return to poverty levels that we haven't seen since before the commodities boom. But we expect that with the potential economic recovery, these indicators will improve again. But this is a different topic, the future prospects for economic recovery. Let me just focus on a few points, if I still have a couple of minutes. The economic impact of the pandemic was greater on women than men. So the women workers have run higher risks of losing their jobs than the male workers, something which has been seen on this region. So it had a very decisive gender impact. And this puts Latin America in a situation of fragility. And the tax situation is deteriorating. Public debt is increasing enormously. It has increased in 10 percentage points. So Latin America is the most indebted region in the world. with the exception of the most advanced countries, which have higher levels of indebtedness. And comparing with the situation before the pandemic, where there were already social movements, political instability in Haiti, Ecuador, Chile, without of course mentioning Venezuela, which is living a very great instability. So the pandemic has found Latin America in a situation of high fragility, and I imagine the impact has been particularly devastating in this region.
Yes, so I think I was supposed to be the next one taking the floor, and it seems as if there are some technical difficulties with the chairing of the session. So I will start providing some insights, focusing on a different region, namely Sub-Saharan Africa. But before I spell out some of the key economic impacts for Sub-Saharan African countries, let me say a few words on what has been teased earlier. What is state fragility? What type of fragility definitions can we actually take as granted? And if you're interested in state fragility in more detail, you're very welcome to have a look at the online data tool that the German Development Institute has put on their website, statefragility.info. And this data tool, Constellations of State Fragility, allows interested researchers, practitioners, policymakers to see how more than 170 states of the world scored in terms of their capacity, authority, and legitimacy. Building on these three core functions of the state, our state fragility tool at the German Development Institute distinguishes between different types of fragility. So it sheds more light on the different types of fragility that are around, and can help to understand which specific challenges fragile countries might be facing and what types of fragilities are out there potentially. So for example, countries such as Brazil, according to this analysis, mainly struggle with violence or crime, exposing a rather low state authority. Others, such as Ghana, are in this perspective characterized by weak state capacity, leading to, for example, deficiency in basic public services. So the underlying idea is that it makes sense to focus on these different patterns of fragility in order to enable users to visually explore the different constellations of fragility. Users can download graphs and maps, compare countries in terms of their capacity, their authority, and their legitimacy, and assess data for 10 different underlying indicators, such as child mortality or a state's monopoly of violence, to understand better what challenges potentially fragile countries are facing. So feel free to have a look at this online tool on statefragility.info. And then when we're thinking about the impacts of the pandemic COVID-19 in the region of Sub-Saharan Africa, it makes sense to put a specific spotlight on different country types. And we did so in a study undertaken with a bigger team at the German Development Institute that focuses on the specific structural challenges, but also opportunities in African countries and in different types of African countries. And looking at the economic impacts, we find that although direct impacts on GDP growth may be less severe in many African economies compared to Latin American or Caribbean economies, or in fact also compared to OECD countries, in the coming years we can expect, of course, huge economic challenges in many African countries, because weak fiscal and external positions and large current account deficits, low levels of economic diversification, also high vulnerability to climatic shocks and other natural disasters, also difficulties accessing supply chains may delay African economic recovery. looking at some of the numbers, the actual numbers for the year 2020 turned out to be less bad than the projections. But overall, many African countries were hit strongly by the pandemic in terms of GDP. So overall, across all countries, the African GDP, so to say, contracted by more than 2% in 2020, but there were significant differences across different country types. And the worst projections we saw, especially for conflict-prone countries, which are often, of course, also fragile countries. Looking at the numbers for 2020, we see that especially tourism-dependent countries suffered substantially, facing GDP contractions of more than 11% in 2020. But also resource-dependent countries suffered substantially, having to face GDP contractions of more than 4.5% in 2020. Countries that were less dependent on resources were not hit as hard, but still facing contractions of their GDP. So it's important to not only look at the overall numbers for African countries, but also look at different country types. And we find that especially conflict-affected countries were hit very strongly. At the same time, we can also draw some positive lessons, particularly that the overall macroeconomic situation of African economies proved to be quite resilient, and good macroeconomic management was able to control, for example, debt levels in many countries. So good macroeconomic management really played a positive role in many instances. At the same time, of course, we saw that the pandemic caused state revenues to fall by more than 10% already, and this is expected to continue. And of course, also expansionary fiscal policies lead to growing fiscal deficits, especially in LDCs, but also in middle-income countries and also in conflict-affected economies. So, of course, the challenge of debt is one that will play a key role in many African countries, but also beyond this region in the years to come. And maybe I'll stop here and look forward to further inputs. Thanks.
I'm really sorry because I suffered an unexpected fragility in my connection. So unfortunately, I had to switch it off and switch on again. The question, in fact, I was hoping to put Clara is precisely what you said, to give us the main conclusions of the report of the Institute for us to have a more wide-ranging idea of the impact that the pandemic may have in African economies. I'd like to ask Paulo Gomes. Last year, the African Union, through its Center for Control and Prevention of Diseases, launched a PPP with Afro champions to raise funds to respond to the pandemic with a goal of strengthening and improving the intervention in the health sector. I'd like to ask you, what did you attain? What you achieved is sufficient to respond to the existing challenges? Thank you very much. I believe that's a very innovative aspect in this combat against COVID has been the feeling of urgency that Africans felt right at the beginning when the pandemic started. The countries immediately started working together to face this pandemic. Most of the countries have many elements of fragility, so countries started working together right away. There were social distancing measures. The economy went into a coma, and with the consequences that we all know about. And we immediately created some working groups at the level of the African Union, and I was part of the Special Fund to mobilize resources to tackle the creation of public-private partnerships and the support to health professionals, because without a good support to the professionals at the front, we could not fight against the virus the way we did, because there were catastrophic scenarios for the continent. Unfortunately, there were many deceased, but it was not what the catastrophic scenarios were predicting. And this is possible because there was this feeling of urgency, a rapid mobilization of African countries to try, although with scarce resources, organizing themselves, and our group was able to mobilize up to $70 million to support different countries. It was a movement of solidarity between the African countries and private partners, the Africans in diaspora and NGOs. Everything joined efforts to support the situation. CDCI, Center for Disease Control, showed that Africa showed an agency of this sort, which became a leader in these negotiations with countries with a very small team in Addis Ababa. But it was able to interact with countries, to support countries in terms of the logistic chains, which we organized in Addis Ababa with the Ethiopia Airlines to provide PPEs for countries, and it was possible because of the supply chain. So this is the part of fighting the virus. But I would like to tell this joke of Mao Zedong when he was asked what, in his opinion, was the impact of French Revolution, and he said it was too early to say what the impact was. So I would say that the impact of the pandemic in social terms, it's still too early to assess what the impact is. The social impact, well, of course, the economic impact we know for sure, and what George has just said for Latin America also applied to Africa. But the biggest concern of mine is the social impact, because economy is now in a coma, is now comatose. Our immune system in the administration was already weak because we are a fragile country. So it's like the virus. The virus goes into the human body when the immune system is weak. And the same thing applies to the immune system of the state. A state with a weak performance and a very low governance level. When the virus started, it came about in the moment when the plane was about to take off, and then this happened. How to recover this? How can we recover economically speaking? We still don't know. But in social terms, the situation is even more serious because there is a great frustration, and what characterizes the fragile states is this social tension, this lack of social harmony and trust, which characterizes fragile states. And this virus even made this process even worse, aggravated this situation. So personally, as an economist who, and I also worked in the World Bank for many years, and I've been working with international systems. So the way the international financial system is not responding in a proportionate way to what Africa requires. Nobody is asking why has Japan promoted an economic financing of almost 20% of their GDP, and this applies to the US. So Africa only has 2%. So why Japan, with solid infrastructures, a strong state, a very robust social capital, why Japan, to come out of the crisis, injected 20% of their GDP? These are all items that should be taken on board for us to be aware of the proportions It's not the measures which are being implemented economically, which I believe are important. This is an opportunity, in my view, to discuss fragile states, to help them not just on the economic side, and of course, and in fact, even some countries do not have these financing, but to see in social terms what can be done to help these countries to decrease this tension, which can explode overnight because of the frustrations we have felt during 1.5 years that COVID has lasted so far. Paulo, let me ask you, you talked about a very strong public investment in Japan and United States to recover from the impact of the pandemic. This public investment, if in proportion, has not been the same in Africa, but it has not been the same in Europe. My question is, somehow African countries have rather followed the European model, even for historical reasons, let's say, closer proximity, greater influence. Have African countries followed the European model or the North American model or the Japanese model? And how this has an impact? The European model, there's also been a very important capital injection to stimulate the economy, but not 20 or 25% of GDP. No, but there's been a mutualization of resources in Europe. There's this strategy in relation to these certain European countries to help them face the crisis. And there's also this feeling of urgency. The question for Africa now, with many decisions will take place, and we'll have many resources which will be mobilized from the IMF before August, and many of the funds are going to the economy. For fragile states, is a big opportunity for social dimension, those aspects which have more to do with social engineering required for these countries, and this should be taken on board. This cannot be discussed with the IMF, and the World Bank has a much greater ability to do so, but I don't know if the resources are enough at World Bank level to be able to support these countries in a predictable way. The countries have to feel that this support is going to be there for a long period of time. It's a single event in the history of mankind, the generalized impact upon our economy. Some figures in Africa, we have between 80 to 95 million micro companies and SMEs. So it's around 90 million micro companies and small companies. So each one of these companies have 1 to 10 employees. We have many informal companies as well, but this is more or less what these SMEs are like, and most of them are completely out of activity, and there is no systematic program to help resuscitate these micro companies, micro businesses that basically are disappearing. And some countries even tax these small companies. Sometimes I've seen some programs imposed by countries where there are measures for tax increase. It's incredible to think about this. So there is an overall lack of coordination at worldwide level, which has to do with the world leaders. For instance, we had the presidency of Trump, which is now is being overcome by the new American administration, but the multilateralism that we required to face this virus, unfortunately, is being very slow to come to effect. So the social consequence of this virus is going to be felt in the next couple of years with a very strong political impact. George started to tell us about the drawback that the pandemic implied in terms of poverty reduction. And in Latin America and the Caribbean went back to the first years of this century. So the question is, what are the prospects for economic recovery? Of course, having in mind the challenges that these countries faced during the pandemic. Starting to give you a couple of figures, what we forecast at the World Bank for Latin America as a whole is that the GDP in average would increase 2.5%. This is a partial recovery compared with the contraction which has taken place last year. With these heights, a great heterogeneity between countries. In some countries are going to recover more rapidly, and others are going to continue to basically stagnate, and the GDP of the region is not really going to totally recover, at least until the end of 2022 or even 2023 in the best possible scenarios. So the big question, and which has to do with the predictability mentioned by Paulo, the big question is, we are in an era of a high level of uncertainty. Even these forecasts that I am referring to, both regarding poverty and GDP, are very uncertain. There is a great variability. I would say there are 5 main factors affecting recovery of the countries in Latin America, but of course these factors can also apply to other regions. When Clara mentioned Africa, there was a certain consistency into these two scenarios. So the factors are the macroeconomic policies. Firstly, the vaccination process, the state of the world economy, the pre-existing restrictions to economic growth, and finally, luck. Bad luck, good luck. These 5 factors are going to have its say one way or another. In terms of the macroeconomic policies, going back to a topic which is mentioned both by Clara and Paulo, the question is how to keep stability or tax sustainability without changing the growth prospects and poverty reduction across the region, because poverty in Latin America is very sensitive to growth. It has a great deal to do with labor markets. If the economy boosts again, so the poverty levels are going to increase substantially. But the problem is that Latin America suffers from a fiscal policy which is very restricted. The ability to put into effect a very necessary measure in terms of public expenses is very much restricted for the fact that Latin American countries, before the crisis, have very high levels of debt. They had a very high sovereign risk, so they restrict the ability of governments to incentivize tax benefits. Bolivia, Peru were able to have funding around 10 to 12% of economic recovery stimulus. For instance, when we compare with Japan or United States, there is a huge discrepancy in terms of public investment. In the other side of macroeconomic policy is that there is a moment when there are inflation expectations they're appearing. This is very for instance, like Venezuela or Argentina. But policymakers have to be really careful and do not exacerbate the inflation forecast, because the sale of food is increasing and the commodities price is growing. The second factor, vaccination. Latin America is still lagging behind the expected levels. Chile has attained a good deal of progress, even so it has felt some difficulty in containing the expansion of the pandemic. The higher the speed of the vaccination, the speedier will the economic recovery be. This is like tautology, because without vaccination, the risk of going back to lockdown is very high, and this has an impact on the recovery. In relation to the state of world economy, most Latin American countries depend from a part of world economy. Most Latin American countries export commodities. Most of the Caribbean countries depend upon tourism. Most of the Central American countries are dependent upon remittances. So each one of these aspects is dependent on what will take place in developed countries. And in China, it is essential that recovery will take place in a very speedy fashion. In the trade partners of Latin America, so that we will benefit from this situation. The World Bank forecast for the growth of world economy in 2021 is 5.6%. It's acceleration, but also based upon a very low growth level. The US, an estimate of 6.8%, and China in 5.5%. So if this is true, this will be good news for Latin America and Caribbean. Let's see, because uncertainty is high. The problem is that Latin America also has some pre-existing conditions which hinder economic growth. Latin America was not growing before. For instance, in terms of labor productivity, very low. It's more or less 30% of the United States level. And this is for many decades. We never overcome this level. And inequalities in Latin America, which is another factor which has a strong impact on growth. Latin America is the most unequal region. So it have 51% of the inequality. Only South Africa, I believe, which is higher in terms of inequality. Informality, it's very high informal economy, which greatly affects the growth prospects. In average, informal sector represents 35% of GDP in average. So it is, compared to sub-Saharan Africa, it's a big variation in terms of countries. Peru is famous for having a very, very high informal company sector. And luck. Well, we are very sensitive to external shocks, should it be political or natural shocks. Caribbean in particular is very sensitive to natural catastrophes such as hurricanes, which occasionally earthquakes or volcanic eruptions. So this also affects our growth forecast, because if a country is affected with this shock, it paralyzes the country again. For instance, an example of a very fragile economy, St. Vincent in Grenadines. It was affected by a hurricane 2 years ago, COVID last year and still today, and then a volcanic eruption at the beginning of the year. So it's a triple shock in such a small economy. They suffer these triple shocks. And in fact, it's very difficult to recover from this situation. And when we see hurricanes and other natural catastrophes, the climate change is an aggravating factor. So these are the main factors which are going to influence recovery. And again, let me focus on the uncertainty of these prospects. So we're really in a situation of a radical uncertainty, which is unprecedented. This uncertainty is not just in Latin America and the Caribbean. I read on Standard & Poor's Global that Sub-Saharan Africa, you know, Clara, is going to be one of the regions which is going to grow at a very slow rate, and taking into account the economies of the 5 important countries in Sub-Saharan Africa, Ethiopia, Ghana, Kenya, Nigeria, and South Africa, will be 6.6 less than the former estimate in terms of on a long-term perspective by 2024. So by 2024, these economies will have a 6.6% less weight in relation to the previous estimate. Isn't this worrying? Shouldn't it make us rethink the way countries use money? Does it make sense to use their national bank reserves to stimulate the economy? Or international aid should be reorganized?
Yes, many things. I think this is worrying. These numbers are worrying. And at the same time, I want to underline what has been said about insecurity of the situation. Some of the projections, for example, also by the African Development Bank made earlier this year about some V-shaped recovery in many African countries might be overly optimistic, looking at the more recent trends with more than 500 million new infections, with almost 500,000 new infections in African countries in less than 50 days in June, starting in mid-May. And so it all depends on the race also, to have people vaccinated. And that's one of the important factors that were also pointed out earlier. So I think for a global perspective, it's very important to keep in mind that the pandemic is not over until it's over globally. And I think this is something we have to keep in mind. And so I think it's very important, as you say, to clearly reflect upon what can be done, how money is to be invested for immediately attending to the challenges of the pandemic, but also investing into the recovery. And I think thinking about vaccinations, I think there should be more efforts globally to support access to vaccinations worldwide. I think the G7 have made a promise just a few days ago at their UK summit, but I think the promise was not substantial enough to make sure that we keep vaccination rates rising at the rate we need them to rise, also in order to be able to cope with new variants popping up. And this is something we can see also recently in many African countries. 3 more quick points. I think you're very right, it's worrying. One interesting fact I want to pick up from Paulo, because he mentioned social trust, social cohesion. And in general, I think it's very important. I mean, the topic of this panel today is on economic impacts, especially in fragile countries. And I think, of course, the economic impacts are very important to take into consideration, because they, of course, are closely linked to other impacts that matter a lot. But I think it's very important to stress that we also have to look at poverty, at inequality, and we mentioned some of these important challenges already here in this panel. So picking up on this point of social trust, social cohesion, one of the interesting and important insights of our empirical analysis in the study I mentioned earlier is that that social cohesion actually plays a key role in a society's resilience to the pandemic, and also the way it can recover from the pandemic. So social cohesion results from good, trustful relationships within a society and also between a society and the state, but also from individuals cooperating together for the collective to common good. So high inequalities and high social tensions have led, so that's our finding, have generated more severe lockdown policies and negative consequences in many middle-income countries. In contrast, we find that many LDCs actually show higher levels of social cohesion, and this greater cooperation between the different social actors that comes with social cohesion in these countries resulted in milder lockdowns. And so the underlying idea is that strong social cohesion in society can help to get through the pandemic effectively or more effectively with milder lockdowns, and thus potentially with milder economic impacts. Of course, this is something that varies across different country settings, but I think I wanted to mention that we also think that social cohesion and the social structure of a society plays an important role in understanding the impacts of the pandemic, but also the way we recover from the pandemic. Yeah, the second point is that I think it's especially important to have a look, looking at the questions you raised, Ricardo, on looking at fragile countries, at conflict-affected countries. Many structural weaknesses in these countries make it difficult for them to even begin to recover. And so that's very challenging. They have the worst growth predictions, they are highly dependent on natural resources, have extremely low revenue collection capacities. Then we have social structures that amplify the pandemic's effect, that cause poverty and inequality to rise or even explode, including due to food insecurity, limited access to healthcare, social protection, and also lacking institutional capacities. So all these challenges make it even more important to put a specific focus on fragile countries. And looking ahead, I think it's important to keep in mind that we do not only invest money in economic recovery, but also really think carefully about how to invest money in recovery. And this is not only a national task, but also a global task. And I think, yes, development cooperation and development aid, but also more structural cooperation across different states plays a key role here. Because investing all this money now to try to cope with the challenges of the pandemic and to recover from the pandemic means that we have a chance to also promote goals of the transformation towards sustainability, to promote environmental protection going forward. And I think it would be difficult to now invest too much money into fossil fuel-based industries, into more traditional industrialized sectors. I think this is our chance to invest in future-oriented, low-carbon technologies and sectors to the extent possible. So making use of all the financial flows that are generated now in the recovery process to really try to make sure they're not invested in fossil fuel-based industries, but in forward-looking, future-oriented, low-carbon and clean industries would be important to keep in mind. At the same time, of course, we know that this might really, this might heighten structural inequalities across the world. It means that countries that have more financial resources to invest now in innovation and more resources to invest in future-oriented recovery from the pandemic will be likely take greater gains from these innovations. So we have to keep an eye on this potentially further increasing structural inequalities across countries. And that's where I think, again, we have a global responsibility to make sure that these inequalities are addressed and tackled.
Paulo Gomes, pensando no futuro.
Paulo, thinking about the future, Clara was giving us a future prospects. The concern of African states is with the need to decrease the external dependency of the continent, strengthening mechanisms of solidarity between African countries, trying to them to depend less from Chinese, European, and American aid. This dependency is not just from financial resources, but also in terms of mindset. COVID-19 has put this on the dependency on the agenda, because countries with the crisis realized that they had their own energy to move forward. Each one tried to solve their own problems. So this was an event which it caused the trigger of the awareness. We require a resetting of the mindset. It's very healthy because we have to be realistic. We don't live on la la land. And reality is rapidly showed that the world where we're living in, this is going to require a different type of responsibility from in African countries. A new generation is facing this differently. So this is the good news, but the challenges are there. We are seeing in terms of vaccination, you have a 60-12, you have 60 out of 100 people ratio, have a ratio of 2 out of 100 people vaccinated in Africa. So vaccine will not be on time to help African countries to face the pandemic. There's also an opportunity for African countries to start manufacturing the vaccines in Africa, and this has already started in countries like Nigeria, Ghana, and Senegal. There's been an increasing awareness, and the existence of CDC, the Center for Disease Control in Africa. We didn't have this sort of agency, so there is an entity. We have people who are highly specialized, who were in CDC in the United States and in Europe. And then in Africa, the virus has its own specificity and the different variants. We know in Africa, we need in Africa to have a minimum capability to do genome sequencing to know exactly what type of virus is here. And we know that will be more virus, more pandemics, just getting ready for the next one. It's a need. I believe that the world is now thinking about cooperation. So what was lacking in the pandemic was a world leader in terms of cooperation. You really have to be honest and straightforward. If at the time we had in the United States, in Brazil, or countries where people, leaders accepted that yes, we have an issue and that the virus didn't have a political color that attacked all sorts of human beings, I believe combating the virus would be different. And I believe that is a great lesson for the world leaders to think how we're going to get ready for the next pandemic. And this time around, we're going to have more agile mechanisms and more intelligent mechanisms that we have seen in this crisis. The spirit of solidarity in Africa, of a greater Pan-Africanism that Paulo has mentioned in several interviews of yours, doesn't require to think about the economic model of the continent. As you know, the continental agreements of trade, it's a very important program. We have 10 years to put it into effect until 2030. So how in the next 10 years we're going to create policies, mechanisms to produce more in Africa and to sell more within Africa? because it's the best cushion you have in relation to external shocks. So Africa cannot even produce clothes, syringes. We need to create, in average, 10 million, 20 million jobs per year. And you create this with at least mini industry, as Clara said, that should be as green as possible. It's not going to be obvious, it's not going to be easy, because Africa's growth is going to bring some environmental challenges. But these 20 million jobs have to be created, and they have to absorb jobs. I'm going to give you an example. We import in Africa millions of dollars of second-hand clothes, third-hand clothes. If you go to Bissau or to Bamako on holidays, you see lots of clothes and second-hand clothes. In countries where there is a capacity of manufacturing clothes with good, with the textile industry, as some countries suddenly decided now, every schools, the schools have to have a uniform made with local fabric, and it's creating a huge production capability for SMEs in textile industry, employing women. And this impact is much higher than the budgetary support given to a state to strengthen the state, because this creates a ecosystem of SMEs and also employing women. Rwanda has also prohibited the importing these clothes, have decided not to authorize the import of plastic bags. So it's creating a paper industry made of banana leaves for packaging. This is the sort of measures we're talking about. There's going to be a need in these relations with the most fragile countries to see the specificities of the countries. NGOs will then work with the governments, even if the governments are weak, so that a better coordination should arise. In what I was saying initially, in fragile countries, we require social engineering to strengthen cohesion, trust, and reduce conflicts. Because when the state is weak, all these elements come to the surface, and no funding is going to solve these problems if there is no internal strategy with support, with external support to solve the social tensions of social cohesion and social re-engineering. We have to be honest. Sometimes we have ethnic problems and they are not solved with funding, but the perception of the exclusion that we see in administration and in actions. So all this has been taken on board, and they have been aggravated during COVID. Social gaps and ethnic tensions have aggravated during these 1.5 years. Yes, I believe so. Although there's been a show of solidarity, there's been a great deal of frustration. Any sparkle leads, a sparkle can lead to igniting conflict. The sense of injustice can lead to social tension. So there is the need of monitoring these countries in the next 12 months. There is a acute poverty, and people need the minimum for their survival, to feed their children, to have access to healthcare. And here there is a great opportunity, which is technology. Technology nowadays through digitalization, allows us to map where the people are and how can we deliver support. This is a great opportunity that COVID gave us, and you should take advantage of it to channel the support of the state to families. Social programs and income distribution programs are very important in Brazil at the beginning of the century. And in the last elections, they are politically important. But this is not my question to you, George. This deepening of social and ethnic tensions in some cases because of the discrimination of indigenous peoples in Latin America has become worse in Latin America. I'd like to recall, to remind the public that you can put your questions through the streaming platform or YouTube channel. Thank you. I believe that this question of social tensions in Latin America, besides being a problem per se, because we have very high inequality level, but they affect the quality of the economic policy. It's a source of additional restriction that policy makers have to cope with. Before the pandemic in 2019, you probably remember Latin America in several countries had a problem of social abolition. They faced social unrest, and Chile, Bolivia, Colombia, everywhere. We have some indicators which measure social unrest. Suddenly, when the pandemic came about, these trigger off. When the lockdown started, people started to be worried with other things. So we have the two indexes: how many times the people look for certain terms related to conflict on Google search, and the frequency of conflict as a topic on the media. Both were decreased during lockdown, and when the restrictions diminish, there is again an increase of this social unrest in Latin America. We are seeing the results, and as I've mentioned before, Latin America is amongst the regions with higher inequality levels, and it's always been the case. It's a characteristic, it's a feature, not a bug of Latin American economy. This has got an impact on the recovery prospects. When there is an increase of the social instability, and this has been measured by some economists in IMF, there is an immediate economic impact on GDP, which can expand during a couple of quarters. So policymakers see the space for maneuver, room for maneuver becoming more restrictive with fewer options. So Latin America is in a situation which is not to be envied. We used to have very high social tensions, which made the situation at the time very difficult with this growing social unrest. And now most of the governments have only a small room for maneuvering via fiscal policies. So the gains and the recovery are more incremental than what is expected. Why don't I have any fiscal space if the Latin Americans are not integrated as Europeans are? A country such as Portugal, Spain, France, they don't have their own currency, they have a common currency. There is an attempt to have a more harmonious fiscal policy. They can argue that they don't have fiscal tools to solve problems of their own domestic economies, but in the case of Latin America, this is not the case. That's a great question. The question is that the tool is theoretical at the disposal of policymakers. They are autonomous to lead fiscal policy autonomously, regardless of what is taking place in other parts of the region. The problem is that this comes from the past. Latin America, after the end of the commodities boom, started losing tax revenues, and it's maintain tax obligations, social protection system, and not decreasing public investments. This led to a deterioration of the fiscal policies before the pandemic, and the region has suffered a serious recession in 2014, 2016, and it was just about to recover around 2018, 2019, when the pandemic put a stop to this recovery. The tax recovery process, fiscal recovery process, which had started in Latin America, had to be interrupted because countries had to do something to respond to the crisis. The problem were the initial conditions in terms of taxes in Latin America were unfavorable. And when the pandemic started, there's been an average increase of 10 percentage points of debt, ratio debt GDP. So Latin America is the most indebted region of the world amongst the developing countries, developing regions. And it compromises the ability of governments to respond to the crisis. They do respond as they can, but their ability to respond is less elastic, even they have institutional autonomy to do so. But the economic forces are not there to sustain these policies. Before giving the floor back to Clara, another question. You said that with the pandemic, we gave a step backwards and the return to poverty levels before commodities boom. You've also told us that the pandemic stagnated the levels of social unrest. There are the type of concerns on the media as well. The aggravation of the economic crisis, will it not increase social unrest? Is it one of the concerns of the World Bank? Yes, yes, it is so. The moderation of the unrest levels we've seen was temporary because social unrest is growing again, because structural problems are still there. And in some countries, the population has demonstrated in several parts of Latin America, Colombia, for instance, quite recently has been on the headlines, and other regions and other countries, we have chronic and continuous social problems such as Haiti and Venezuela. Latin America, when it is not rapidly growing, is very vulnerable to this social unrest. Going back to what Clara said in relation to trust and social conflict, the social fabric becomes weaker when the economy is not growing. The cake is now smaller, so to divide the pieces of cake and distribute it to all is more complicated. Let me just correct something I mentioned earlier on in relation to poverty levels. Poverty levels that Latin America has today corresponds more or less to at the time of commodity booms, not before. There's been a very swift reduction during commodity boom. So we did not go back to the beginning of commodity boom, but we are sort of in the middle. And the economy grows again. Recovery of social gains are going to come back. But now this is the end of a continuous process of poverty reduction. Clara, you have talked about state fragility. This is the main topic of this conference, promoted by the G7+. But we can't separate state fragility from the fragility of the international financial system. And uncapped promises by countries who, right after announcing development aid, are very rapid in labeling countries they are supporting as fragile or even as failed states. The question is, who is failing? Who causes fragility?
Yes, many thanks for this important question that sheds light on how complicated the causality sometimes is. And I think it's very true that it's important for development cooperation to keep focusing on challenging, difficult state contexts as well, including fragile states. It might be more challenging. It might require thinking differently about development cooperation, but I think it's very important to keep a focus on working together. It might, as also Paulo, I think, pointed out, it might require not only to work with state institutions, but also with many non-state actors, like NGOs. But it's important not to generate so-called aid orphans that are falling under the radar, that are not receiving the attention they need. So that's, I think, an important message. And it is even more important going forward if we now, I think, see social and political tensions increasing in many regions around the world, and likely to further increase in light of all this economic and social uncertainties we're facing. So I think you're right, pointing to an important point in this direction. In terms of the global value chains that were mentioned earlier, I think it's also interesting to underline, this goes a bit into the direction of what Paulo said earlier also. Of course, we saw that being integrated into global value chains makes countries very vulnerable to shocks via these value chains. But I think, and we've analyzed this also in one of our research studies, of course, showing that being linked to global value chains increased in the short term, in many ways, the impacts of the pandemic. At the same time, being part of global value chains can also help to bounce back and can help to diversify economies, making them less fragile to these shocks, making them more resilient to shocks. So I think it's better to think about how to manage integration into value chains rather than renationalizing industries or shortening supply chains. And I think in the African context in particular, I think the African continental free trade area is a promising way forward to strengthen economic integration among African countries and to also build regional value chains in addition to linking up to global value chains. So I think this is a promising way forward. And thinking about priorities looking forward, ideally, we use the pandemic now as a window of opportunity to focus on inclusive and green economic development as much as possible, linking this to universal social systems, if possible, and of course also creating and strengthening political institutions that are inclusive and that are capable of contributing to the collective goods and providing public goods in the different national contexts. So the pandemic, I think, really refocuses our attention on these important priorities, as challenging as they might be. And as you said, Ricardo, I think it's important not to let fragile countries disappear from our radar when thinking about how the international community can also provide support and work together and cooperate to promote these kind of priorities.
Clara, nesta altura já teremos todos aprendido alguma lição?
We've probably learned some lessons with the pandemic.
I don't think that's the case, but I do think there's reason for optimism. I think both because of this pandemic, but also where we're coming from. If you look at, if I talk about the number of zero-dose children, who I mentioned before, the children who aren't getting a single vaccine, we've reduced the number of zero-dose children in the world's poorest countries countries reduced the number of zero-dose children by 20% over 4 years before the pandemic came out. And so that's a pretty rapid decline. And that's despite significant growth in population in those countries. And so I think we were already on the right track. The question is, can we ensure that we use this pandemic as an opportunity to accelerate progress rather than something that really slows us down?
Thank you. I will go back to you and for you to explain us how Gavi engages really in context of fragility. But before that, I will go to Celine, because one of the questions I would want to ask you, Celine, is how can we ensure a fast and equitable access to vaccine in fragile countries, which goes in the same direction that Alex was talking about?
Yes, thank you. Thank you very much. I would just first like to mention that while I work for CARE International, I'm also here in my capacity as Vice President of Concord Europe, which is the confederation of NGOs working in international development from across Europe. And I represent over 2,500 organizations. I can't say I represent all of civil society on this issue, but certainly here representing Concord. I just wanted to mention that. In terms of fast and equitable access to vaccines, first of all, if we want to control the COVID-19 pandemic, we really need world leaders to take global action on equitable global access to the vaccine, but also to make critical investments to ensure fair and effective delivery of vaccines to all. And I want to touch on a few points. One is on vaccine sharing. We know that the G7 leaders committed to share at least 870 million doses directly over the next year, and to deliver at least half by the end of 2021, primarily channeled through COVAX towards those in greatest need. And thankfully, the EU has committed 100 million doses, and others, of course, have stepped up to this 870 million. But we feel this is far from enough, because dose sharing is urgently needed now. It's not needed next year or over the course of the next year, and it's not a long-term solution. We really need to plug the significant vaccine supply gap, which is essentially caused by rich countries who are massively overbuying and hoarding doses. And I really thought it was interesting how we started on the whole question also of how to even sell the notion of solidarity of vaccines. But I think we also have the how to say, as you started, that none of us are safe until we're all safe. I think that is something that is actually also fairly easy to understand. The New York Times Vaccines Tracker reported, and here I want to quote, that 85% of shots that have gone into arms worldwide have been administered in high and upper middle income countries. And only 0.3% of doses have been administered in low income countries. So at current vaccination rates, low income countries would be waiting 57 years for everyone to be fully vaccinated. So clearly on vaccine sharing, more ambition is needed to meet the urgency of the moment, and especially to address vaccines in the most fragile contexts. But also I should say that these countries, I don't think they just want our leftovers. We have to plan properly to ensure more equitable vaccines access globally. I've read that we have enough doses already in Europe, in the EU, to vaccinate people 2 times over, while the UK and the US could vaccinate their entire populations at 70% 4 times over. So increased ambition on vaccine sharing is possible. Another point that is essential that I want to mention, because not only is vaccine dose sharing critical, sufficient support is needed to prepare countries to deliver the vaccine. And this is also really linked to this whole issue of health systems, which I think will be talking about even more. But this is especially important for those with chronically under-resourced and fragile health systems. And it means that donors need to provide funding to cover the real costs of delivery on the ground, since the low and middle income countries, and especially fragile countries, won't be able to do that themselves. A recent report by CARE International estimates that for every $1 a donor or a country government invests in vaccine doses, lower and middle income countries need to invest $5 in delivering the vaccine. But we know this investment is not forthcoming, and it's not happening at the pace that is required. So, for instance, tragically, we've heard that 76,000 vaccines in Malawi and South Sudan expired before health systems could deliver them, while DRC had to return over 1 million doses, which was unable to deliver due to its weak health system. So really investing in the delivery is critical to ensure that the vaccines can reach all who need them. And if I may I have one last point I'd like to make on this issue is around the vaccines production, because on the whole issue of equity, we also strongly believe that vaccines should be available for all as a common global good, and that this will only be possible with a transformation in how vaccines are produced, including through the fact that pharmaceutical corporations to do that must allow COVID-19 vaccines to be produced as widely as possible by sharing their knowledge free from patents. But it's not only about the patents barrier. The entire supply chain needs to be made monopoly free in order to ensure this access. And that includes export and import barriers, among others. And we know that progress has been made on IPR related to manufacturing and global supply of COVID tools. The Biden administration recently expressed its partial support for the World Trade Organization COVID-19 TRIPS waiver proposal, and that some EU countries have also supported this Biden proposal, Belgium, Sweden, France, Denmark, Spain, and possibly others. Apologies if I miss them. But also the European Parliament has voted in favor of a proposal calling on the European Commission to support the lifting of patents for COVID-19 vaccines and medical equipment. Now, the EC on its side, the Commission, has presented its own proposal, but we don't see actually anything new in that proposal. It only addresses patent barriers and is quite limiting. So just the last point on this is that we really expect more progress on these discussions to ensure that vaccines can be produced globally and equitably and where they are needed across the world to benefit all. And in particular, we would like to see EU and rich countries support a TRIPS waiver for the COVID-19 pandemic. So I'll stop there, just a few points, and I'm also keen to discuss more about the public health systems later.
And we will go back to you, Celine. Let me just remember our public that you can ask questions. So feel free, please send us your questions and I will ask them to our panelists. But just before I go back to Olivier, just one last question, Celine. You were talking about of course, the difficulty of fragile countries' health systems to manage all the not just the giving the vaccine, but all the process. Do you think developed countries should help, and how can they help in that sense? Not just giving the vaccines, but also helping in forming and developing the health systems of those countries. And like Alex was saying, is this the opportunity to do that?
Absolutely, and this is really another issue that I wanted to get to, is that and absolutely also agree that with Alex that COVID-19 has affected health systems, but it's also really an opportunity, and I should say probably all of the tragic diseases, that infectious disease outbreaks that we've seen have at least contributed some knowledge and some learnings that have helped us to move forward. And that's certainly the case with the COVID pandemic. But what it has really pointed to for us is that we urgently need investment in public health systems. So COVID has shown us the importance of a robust and well-funded and resourced public health system, and the need for it to be accessible to everyone, free at point of use, and that we really can use the experience of the pandemic to create resilient and universal, equitable health systems around the world, as you were saying. But one point I would like to make here, and this is where we can a lot more support can be provided. Critical to the health systems are its health workers. It really has become clear in this pandemic that frontline health workers in particular are the linchpin of effective prevention and vaccines delivery, including issues such as building community awareness and vaccine acceptance and reaching rural and underserved communities. I mean, I think this links to what Alex was also mentioning in terms of how vaccines can be an opportunity to reach marginalized communities, but we also really need the frontline health workers to do that. And yet frontline health workers are overlooked, or routinely overlooked, I should say, and chronically underfunded. And certainly in this vaccine, we know that health workers in this pandemic, that we know that health workers in at least 84 countries have gone on strike during the COVID-19 pandemic due to issues such as unfair pay and unsafe working conditions, lack of personal protective equipment. And there's another issue around health workers I would like to mention, which is a big gender inequity element to health work. Because on average, women healthcare workers earn 28% less than their male colleagues. That's a massive pay gap. And that we know that women make up a large proportion of health workers in most countries. So really investment in health workers and in health systems, but really in the human resources is incredibly important. But I'd also just like to point out this learnings, another learning beyond the need to support health workers, just that the experiences of some sub-Saharan African countries in handling other diseases, in managing other infectious diseases such as Ebola, tuberculosis, and even HIV, have served in the fight against COVID. And they also point well to us what can work in fragile contexts. And when we talk about this building back better, we can really learn from what's already worked. In some countries, for example, Sierra Leone, pre-existing emergency plans on public health interventions, on community engagement programs, and also workforces of emergency medical personnel, trained healthcare workers, they were quickly redirected to ensure a fast response to COVID-19. And we do know that this investment in health systems can deliver. In Rwanda in this pandemic was able to use 100% of the vaccine doses they received through COVAX in about 3 weeks, because they had invested in healthcare workers and in robust delivery systems. So I say, let's learn from what works well and what hasn't worked well. And we just need to ensure that the public health systems in fragile states and in the poorest countries that they need support to be upgraded and expanded with global financial support, while also learning from experiences in neighboring countries and in other fragile states, so that we can prepare for similar outbreaks in future. And this really does ensure equitable pay and safe and supportive working conditions for health workers, including women health workers, of course, because they are on the front line of response, whether it is to COVID or to other diseases, whether it is to immunization or longer term public health initiatives. Frontline health workers really need that support and need to have conditions conducive to their work, including support for childcare, hazard pay, funds for health-related expenses, but also, again, this safe working environment is critical. Over.
Thank you, Celine. Well, talking about solidarity, Olivier, I will go back to you. What what are the EU global priorities for this second half of 2021 and 2022 when it comes to vaccine solidarity?
Thank you, Elena. And I will use the opportunity of your question also to pick up on a few elements developed by Alex and Celine. First, when it comes to fragile country or vulnerable countries, we need maybe also to pose a bit on what are the criteria to define these countries, because I'm not sure among us three we see this as the same way. Is it the number of cases? Is it the number of death casualties? Is it the number or the limited access to vaccine due to lack of financial resources? Or is it the exposure of some negotiation through China and Russia that the EU or the US should be there to offer a counterpart? Is it the weakness of the health infrastructure? Is it vaccine hesitancy that has not been mentioned yet, but which is a huge problem in many vulnerable countries where we have delivered vaccine, but not only because of weak infrastructure, but because people do not see the need or do not want or are under misinformation or disinformation in some countries? Or is it the lack of local production or regional production of vaccine? All these criteria are important for us when considering which country should be priorities. We have made a choice, as I said at the beginning, that we will rely on COVAX and on Gavi to identify where are the needs and to ensure the equitable access and the fair access to vaccine. So when we give 3.2 billion euro to Gavi to finance COVAX to attain the very ambitious target that they have for 2021 for all the shareholders, but in particular for the 92 less privileged countries in the world, or when we give 100 million doses, or when we finance with 1 billion euro vaccine production in Africa, in specific countries where there is already vaccination production facilities, or when we support Spain to give 7.5 million doses to Latin America, we try to have this comprehensive approach. Of course, and I'm a bit sad, but I have to live with the political reality, Europe cannot vaccinate the world alone. And there is one fundamental reason that I need to recall is that 1 year ago, Europe was the continent most hit by this pandemic. We were exiting 2.5 months of lockdown, where we witnessed thousands of deaths every day. Let's remember these images. And our leaders, our public opinion, were under the shock of a huge pandemic, never seen since a century in Europe. And we needed, as the EU, to take decision to vaccinate our continent. Is it a lack of solidarity? I'm not sure. This is political responsibility, and our citizens were expecting this. And to come back to your question, Elena, it was already difficult this spring to help our public opinion to move to solidarity while getting vaccinated. It would have been impossible last year while we were just exiting a pandemic and so many thousands of dead people and in our continent to launch a huge solidarity effort. What we did was to create COVAX to provide finances, but the focus was on Europe last year. I'm glad that he has moved away in a way, but we are able now to provide this solidarity effort. But let's not forget that last year we were the central point of this pandemic globally. Let's remember Italy, let's remember Spain, let's remember Portugal and France. And that is a shock for our public opinion. And I'm impressed that out of this crisis last year, EU was able to trigger this solidarity message. And this is, for me, a huge lesson. I don't know another continent, to be honest, that is able, out of its domestic crisis, to send this message to the world that we need global solidarity to vaccinate the rest of the world. Most of the continent, or most of the big G20 countries that we see now hit by the crisis, I don't hear the solidarity message. So I'm quite proud that I've been able to deliver this, and we have been the first. And this also should be acknowledged as a lesson. Of course, we need to do so much more. And let's also be realistic. This task is with us for several years. We will not end this global pandemic by Christmas this year. Probably not also by summer next year. We need to accelerate. We need to do much more. We need to protect everybody, but we need a global effort. Again, Europe cannot do anything, and we are doing a lot. I think we are doing the most we can do. We need to accelerate. Céline is right, but let's be realistic also, and let's program what we can do in a realistic way, knowing what are the conditions on the countries where we want to deliver this vaccine. And that is probably, Elena, the first priority. Where can we have a decisive value added for the populations? Being the health workers, people in the cities, the families, people in the countryside, where it's sometimes very difficult to deliver vaccine, with Gavi and COVAX, or bilaterally, as EU member states can want to do sometimes. This is for us the main priority, is where can we have a value added through COVAX or bilaterally? And all the criteria I have mentioned, the vaccine hesitancy, the situation of the health infrastructure, the situation of health workers, the capacity to have access to vaccine through COVAX or another way, who is going to reach 20% of its population vaccinated before the end of the year? Not so many, contrary to our plans. So should we focus on this? Should we focus on the countries that are most hit by the pandemics? Brazil, or now in Africa, Zambia, or Namibia, or Liberia, or South Africa, or Tunisia? Should we focus on the countries that are closer to our borders and that want to have access to the Schengen area? Again, the Western Balkans, the Eastern Partnership, the southern border of the Mediterranean Sea. Member states are debating that. And I would not tell you a big secret of EU politics that they need to discuss to find a compromise. Let's put it that way.
And it takes time,
It takes time. There is one point on which they agree, and I'm very glad for that: humanitarian situation. This is a central thing on which EU, member states, leaders, ministers, administration come back to their core values. If there is an humanitarian situation, we find often 27 countries ready to help. And that is also an important message, that throughout this crisis, for Timor-Leste or for other situations like this, or Papua New Guinea, we find member states ready to support. So to answer your question in a more Cartesian, rational way, first priority, humanitarian situation. Second, where there is a need, and we see that for the time being, for example, in Tunisia, in Liberia, in Namibia, where the pandemic is hitting hard in countries that are not ready to face this. And not only, Céline is absolutely right, and Alex also, providing vaccine is already quite difficult, but it's not enough. If there is no one there to deliver this vaccine, to inoculate this vaccine, to make sure that the first and the second doses will be tracked, and that there is not, sorry also to mention that, illegal trafficking from the airport to other populations, that is not a secondary market of reselling, and that some traffickers get money out of that, to make sure that the doses are not destroyed because they have reached supposedly expiry date. We need to have a more comprehensive strategy when it comes to not only vaccine delivery, but vaccination process in these countries. Because again, bringing this vaccine to the tarmac of these airports is just the entry point of a process that takes longer. Then also we have to be careful, and this is where disinformation and communication are key. EU support, direct or through COVAX, has to take into account the public opinion of these countries. So not only our country when it's come to be generous or solidar, but in these countries. It's not obvious for Spain to deliver vaccine in Latin America. Not all Latin American country would welcome this. I don't know about Portugal and the Lusophone country, but we have to be careful that this is not perceived as a political gesture that may bring back this country to previous decades or previous century. In Africa, and I can tell you for Francophone countries, it's extremely sensitive. Especially, and we see that in Africa, vaccine hesitancy in Africa is mostly, not exclusively, but mostly a phenomenon in Francophone African countries, because they are influenced by the French debate on vaccine hesitancy, country of Pasteur. But we have to be careful of that. And Céline made a point, and I think I understood a remark that way, not to give the impression that we donate the leftovers. I guess you were referring to AstraZeneca, because we are already financing COVAX to deliver COVID Shield, and COVID Shield is not authorized yet in the EU. We are in the process of making it authorized by the European Medical Agency. But AstraZeneca, who is the owner of COVID Shield, has not asked Europe to recognize this vaccine. And therefore, we are in this odd situation that we are financing COVAX to deliver a vaccine that we don't recognize ourselves. It's not our fault. We are in a legal trap here, and I hope we will find soon a solution. But of course, if we are an African citizen that want to vaccinate your parents and your family, you have doubts. And it's very easy for Russia or China to put some ideas in the social media, which are quite influential also in Africa, that Europe is giving the leftovers of things that we don't even want ourselves. And then that is quite difficult. So our priority is also this, not only to ensure that vaccine delivery can become vaccination process, and we do a lot with our financial means and our delegation on the ground and the support of other international organizations. But we have to take care also about the capacity of people to go into vaccination before the pandemic hit them, because it should be a preventive thing. In Europe, it was a sort of reaction. For other continents, we should try to tell them, which is very difficult, this is a tool for the future. You should protect yourself before the pandemic reach you. Like we didn't do that in Europe. We started vaccination when thousands of people were dead already. So don't learn the same way as we did, because we were not prepared. You are not prepared, it's true, in Africa or in other continents, but we were not prepared to, and we pay a high price for this. So we can have a common agenda and not divide this. Then there is a question of production, and I finish on this, and the intellectual property. Production is indeed very concentrated in 5 countries in the world. It's basically the US, who until a few days ago could not export their production or their excess of production, thanks to President Trump. Now, the Biden administration is turning this around, but they are just starting. EU, and we're exporting so far around 400 million doses to the world, to 47 countries. India, who does not export for the time being due to their pandemics until October and maybe beyond. We need to look at that very carefully because it's a problem for Gavi and for COVAX. China, who has exported as much as Europe while vaccinating its own population. And Russia. Russia is very interesting because they communicate massively, but they produce very little. And they have delivered so far only 2% of their contracts with the world. Well, as I said, we started the year by thinking that Sputnik was spreading all over the world and that the world would be vaccinated with Sputnik and Sinopharm. This is a political and diplomatic lie. The misinformation is there. So basically, who is vaccinating, who is producing and exporting now to the world? China and the EU. Only them. It's a huge pressure on 2 producers. And we have this debate on intellectual property, which is very complex. And I'm glad that we have been able to get out of the games of some powers who seems to support the idea coming from India and South Africa, while they are not exporting one single doses. And and that we, EU, have been able to reach out with the Director General of WTO to support her agenda for the third wave. And we're working with her, all the EU countries and the Commission, and with other partners around the world to support her idea. And she cannot be suspected of having a biased agenda for this, because it's true, and I'm not here to defend the Commission position, but if we make the vaccine available for free immediately, the investment will fall. So who is going to invest in the next Pfizer and the next Moderna and the next Johnson & Johnson to face the Delta variant? Who is going to invest for the next variant? Who is going to invest for the production we need? Because we know we don't produce enough this year. Where this investment come from, if not from the price of the vaccines? And it's not only a commercial argument, it's also to ensure that there is an incentive for this company to invest in it and to get the fair reward for the researchers also. How we compensate all this? By donating, because we know that 92 countries under COVAX do not have the financial means to buy this vaccine. So we pay for them through COVAX, and in parallel, we donate the excess of vaccine we may have. And I just reply on this. I see many figures flying around that we have bought 4 times, 2 times, that Canada has bought 11 times what they need, and that the Western world has, by the whole production of 2021, letting the rest of the world without doses. I see the point, but I'm not sure it's true. I'm not sure 92 countries, EMC countries, would have the means to buy vaccine anyway. Now we are able to donate, but let's recall, we have not decided to buy 30, 20, or 40% of the world production. We are back to last summer, 2020, where no vaccine producer or manufacturers have discovered the vaccine. And we started contracts with all of them. And in the end, we were lucky, all of them find, in a way, except a few ones so far, find a vaccine. So we were legally engaged with all of them, and we signed the contracts with all of them. Not all of them are delivering the doses. So I'm afraid when I see that the EU will have 500 million doses, 700 billion doses extra this year in our fridge, it's not true. It's not true, because AstraZeneca is not delivering. Johnson & Johnson are late. Sanofi has not found the vaccine yet. So these maximum figures that I've seen have to be reduced to something that is more around 200 million or 300. And we are claiming that we will give to the rest of the world and to COVAX already at least 100 million doses. So we may be already giving almost half of the possible excess. And I'm not talking about the vaccination of teenagers in Europe. I'm not talking about the possible third shots that we may need before Christmas. And I'm not talking about further delay that we may have in the rest of the year. Again, we are calling for a global effort and not about opposing continents like Europe or the Western world would be damaging the rest of the world. At the G20, the EU will call, and this is my last priority, will call for everyone to make an effort. Russia, China, the US, India, EU, these are the big 5, and that we progressively ensure a fairer vaccination effort. I see that Mexico, I see that Egypt, I see that Turkey, I see that Serbia, Azerbaijan, other countries around the world that are now reaching a certain level of vaccination also are donating to their neighbors. Australia and New Zealand for the Pacific, Taiwan and Japan for their region. So this is spreading. This solidarity effort is spreading, and this is very good news. I stop here.
Thank you very much. Well, you partly responded to that question, but we have a question from our public. from Patrícia Magalhães Ferreira, and that was around that idea of leftovers. But maybe I will ask Celine and Alex to give their vision on that. It's a really sensible question, like Olivier was saying. And how do you see how do you react to that vision that we are giving our leftovers to the rich countries are giving their leftovers to the fragile or more poorer countries? And she also wants to ask you if how can there be an equitable and global access without sharing knowledge and technologies and patents, like Celine you were saying before. So maybe I will go before to Celine and then to Alex with this question from the public. Celine?
Okay, thank you. So on the question of leftovers, I don't think, firstly to say, personally, I don't think it's an entirely fair assessment to point to the EU's dose sharing as leftovers. I think it's a perception, and it points to the need for support on so many levels. I mean, I've talked about the need to provide more support to health systems and frontline health workers. We know that the frontline health workers, and I'm talking about them again, but they play such an important role also in engaging with communities around vaccination and trying to dispel some of these some fallacies. So just to say that there's certainly, I think Olivier is absolutely correct that the vaccine hesitancy is a real issue. I mean, there is absolutely no doubt that it has played a role in pausing, or not pausing, but in slowing down the rollout of vaccination in many countries. But these are all issues that are part of a health system and a public health strategy, which is another reason why a lot of these countries need support. But the leftover issue is a perception, and it's a very real one. I mean, even reading the press in Europe, we've had so many challenges with acceptance of the AstraZeneca vaccine. So I don't want to minimize it. It exists, it's there, it's a perception, and it could, there may be reality in it, but I think I do think there is a real, the point I was trying to make about leftovers is that we don't want to just appear to be giving leftovers, or it shouldn't seem that this solidarity that we should be providing from Europe, but not just from Europe, from all the rich countries, it shouldn't just be, oh, well, we've vaccinated our own, now we can just give a few leftovers. What we are trying to advocate for is a planned and global response of global solidarity. So that's the approach that I was referring to with the leftovers. I hope that's clear. Over.
Thank you, Celine. Alex, how do you deal with this issue and this perception of the leftovers?
Thank you, Helen. No, I hope we're not creating a perception of leftovers in the course of this discussion. But I mean, I think it's important to say these vaccines are critically needed, and they're critically needed now. These are not different vaccines. These are the same vaccines that are being used around the world. They've all been, COVAX does not provide vaccines that have not been WHO pre-qualified or licensed by a stringent regulatory authority. So these are, these are the high quality vaccines. And I think the term leftovers runs the risk of implying somehow it's different. It's not. These are the same vaccines. But it is critical that, the timing of doses is critical. And where I think, that sense of leftovers is important is it is important that we actually are able to plan supply and that we know what's coming. Because right now we're in a very supply constrained environment. That there are, unfortunately, the scale up of supply to the world's poorest countries has been much slower than anyone had hoped for various reasons. And there's no single reason for that. And in that context, it is critical that we have an equitable approach to how those doses are allocated, and that's why COVAX is so important, because it's one global solution to be able to equitably allocate doses across countries. And that allocation should be driven by who has greatest need. So that is the healthcare workers who are at most risk of exposure, and who also can be so critical to responding to this pandemic. To Celine's earlier point, that's important both from a public health point of view. It's also incredibly important from a gender equity point of view, because 70% of those health workers are women, and they are at highest risk. But it's also, but very soon we're going to pivot from a supply constrained world to a demand constrained world. We are going to see a very rapid ramp up in supply to countries around the world. We expect that could go as high as 400 million doses per month available to AMC eligible countries through COVAX by the end of the year. And that is a huge increase in supply, 6 to 8 times the number of vaccines that countries would typically be receiving through Gavi over that time period. And so the additional capacity needed to deliver those vaccines is huge. Celine spoke to this very eloquently earlier. To give an example, I mean, the WHO estimated that these countries would need 400,000 additional healthcare workers just to deliver those vaccines. And so the timing of supply and the predictability of supply becomes really critical in that context, because it's not just about the number of doses that countries receive. We're talking about health systems that have an upper bound in terms of how much volume they can deliver. And what we've seen in high-income countries is they've been able to steadily ramp up supply and delivery over time. And the risk in poorer countries is that they are going to receive vaccines when they become available, and it could be a much steeper ramp up in health systems that have lower capacity. And so that sense of where I agree with there's a risk around the concept of leftovers is if we can't predict, if we don't know what doses countries are going to receive through COVAX and when they're going to receive them, they can't plan. It's very hard for example, on hesitancy, it's very hard for a country to roll out an effective community engagement and demand generation strategy for a vaccine that they haven't received yet. The last thing you want to do is get people turning up to health facilities to demand a vaccine that doesn't exist. And so that predictability of supply is really important. So we're really grateful, for example, in COVAX for the 100 million doses that the EU has committed to provide, and that is incredibly valuable. But we call on all donors who are donating doses to really try and give us a firm schedule of when, and the sooner the better, because we'll have plenty of doses, we believe, 4 or 5 months from now. The doses, what we don't have is plenty of doses now, and countries have capacity to deliver doses now. So that's going to be really important. And the other thing that's going to be really important, and Sabine spoke to this earlier, is delivery funding. We are very grateful that we've received almost $800 million from donors to help support countries to roll out these vaccines, complementing $12 billion from the World Bank and funding from others. But I think we should all recognize the health system challenge here is unprecedented. And as Olivier said, it's not this year, it's this year and next year, quite possibly the year after. And if we need boosters, we don't know how long this will go on for. So we really need to ensure the resources are available and are being strategically invested to ensure that we're not just rolling out doses now, but we're building systems that can roll them out for the longer term.
Thank you, Alex. I will keep with you because we are talking about how difficult the process of giving those vaccines and the whole process until the inoculation is in fragile countries. So how does Gavi engage in context of fragility?
Yeah, thank you for the question, Helena. And I think if I go back in time, Gavi started as a pretty one-size-fits-all organization where we essentially said to countries, here's the vaccines that we support, and had a pretty standard process for how countries applied for that and how we rolled it out. And I think we've realized and recognized over time that in many different types of countries, but particularly fragile countries, we need to be much more flexible and adaptive to the unique challenges of fragile settings. And so we have been doing a lot to adapt and to learn. We are continuing to adapt and to learn. I don't think we would say we have fully perfected our support to countries. We can always do better. There is definitely a significant challenge around immunization in fragile contexts. We saw over the last 5 years that immunization coverage in fragile countries plateaued, whereas it increased significantly in non-fragile countries. And whereas about nearly 85% of children in non-fragile countries are now receiving a full course of basic vaccines, less than 2/3 are in countries at least Gavi classifies as fragile. So there is a gap there, and that's a gap that's really a focus for us as an alliance to help address going forward. In 2017, we introduced a new policy that was called the Fragility, Emergencies, Refugees Policy, and it was really designed to allow us to be much more flexible in our support to countries, to adapt what support we provide, how we work with countries, our processes, to meet their unique needs and their unique contexts. And it deliberately wasn't prescriptive because we recognize that every fragile context is different. I think while the overall progress I mentioned, unfortunately, we have not seen the progress on coverage in aggregate that we would like to see. We have seen that progress is possible, and actually rapid progress is possible in settings where you have a certain combination of factors. And those include really strong political engagement and leadership, a focus on time-bound and quite measurable results, alignment of development partners, and importantly, alignment of international funding and donor funding to a domestic plan. If I take the example of DR Congo, for example, the Ministry of Health developed in 2018 a plan they called the Mashako Plan, which was designed to focus on 9 of the highest or most vulnerable provinces in DRC, and to try and raise full immunization coverage in those provinces by 15 percentage points, which is a pretty ambitious goal. It had incredibly strong leadership from the Ministry and Minister of Health, and secured support from a number of development partners, including Gavi, who aligned their financing behind this plan, and then with a joint mechanism for reviewing progress and course correcting. And what's happened is actually since then, the country has managed to exceed the target it set. They've increased full immunization coverage in those 9 provinces by 27 percentage points. That's an additional 500,000 children who would not have been immunized otherwise, who have been immunized due to this. And that's in some of the most challenging regions of the Democratic Republic of Congo. So progress is possible, but it does take that combination of strong political commitment and leadership and a willingness of development partners to really align themselves to that. I think what we've also seen is that we have to be adaptive in terms of understanding who has comparative advantage in these settings to reach communities and engage with them. Immunization is typically a government-provided service, and it's very effective in many settings that way. But there are settings where government services can't reach communities. And so in Afghanistan, for example, we worked with the government to develop a new partnership with the International Federation of the Red Cross and the Afghan Red Crescent to be able to deliver services and generate demand by engaging communities in regions that government services were not able to operate. And through that partnership, an additional 40,000 children have been reached. So I think that speaks to the need for everyone, every stakeholder, to be willing to look at how do we create the space to objectively identify the partners who really can reach these communities and support them to do so. We do need to continue to actively seek out new partnerships in this space, and particularly in these settings. And Gabby is actually about to launch a call for proposals to see, to identify humanitarian partners who may not be currently major players in the immunization space, but who can help scale up new approaches, especially in cross-border conflict settings, which is often one of the challenges with government-provided services, is where you have large population flows across borders. It becomes unclear which government is accountable for immunizing those populations and to track those populations. And so we need to look at situations like that, understand where the challenges are, and look at how can we find new partnerships and new models to reach children in those settings and reach communities in those settings. I also think we need to think more about demand, and we've talked about hesitancy, or as we like to call it, vaccine confidence, quite a lot in the course of this discussion in the context of COVID-19 vaccine. I fear the risk of this pandemic is that hesitancy, which was not a major issue in many countries we work with historically for routine immunization, there is a risk that that spreads from COVID-19 vaccines into routine immunization. And it's really important that that we take a much more deliberate approach to understand, to responding to that. And that requires different approaches. Historically, we've relied too much on telling communities why immunization is important and why they should get it. And what we need to do is understand, why do they have doubts? What are their concerns? And how can we best alleviate those? And they're going to be different for different communities. And I think for us, really understanding that the demand side is as important as the supply side is going to be critical if we're going to reach some of these populations, because some of them, even in fragile settings, they're not, they can be within a kilometre of the national vaccine store. They could be living in an urban slum in the capital city, but they may not be seeking out services for reasons that actually have nothing to do with immunization. And often they have to do with the trust and confidence they have in those who are providing the vaccines themselves. And then lastly, I think just to bring it back to COVAX, one of the critical elements of the design of the COVAX facility is the humanitarian buffer, which is designed to ensure that COVID vaccines are available everywhere they're needed, including in areas where they wouldn't be provided otherwise. And so areas, for example, outside government control or in instances of state failure. And that's something we're set up to be really flexible and agile, to be able to rapidly identify where are there pockets of populations who are not going to be reached otherwise, and to be able to respond rapidly. It is a measure of last resort. We don't want this to be we think it's very important that countries and governments take full ownership for their populations to the extent they can, but we recognize there are situations where that's not possible, and the humanitarian buffer is designed to step in where needed. So those are just a few examples of how we're trying to adapt our model to work better in fragile contexts. As I said at the beginning, I don't think we think we have all the answers. I'm sure some of the countries in the audience can give us feedback on what we could be doing better and doing more of, and we are continuing to try and adapt and improve. But we've certainly come a long way in terms of trying a range of new things and different things over the last few years, and we will continue to learn from that.
Thank you, Alex. So that hesitancy is really a major challenge you have to deal with, and having those local agents, and it's really important to have the trust to gain the trust of certain populations. But okay, hesitancy is a challenge, but to Celine, what do you expect the EU and the G7 leaders to do to support your work and to support fragile and poor countries in this COVID pandemic?
Yes, thank you. Well, the G7 Leadership Summit, of course, took place 2 weeks ago. And we, certainly as civil society who've been advocating around the global COVID-19 solidarity, we had high expectations that the leaders of the world's 7 largest advanced economies would decide to take the fight against COVID-19 to another level and agree on a comprehensive global plan to end the pandemic. And we were disappointed by the outcomes from the G7, because we do believe that there's a need for urgent action and leadership from the world's richest countries. And we know that some action is being taken, but as I mentioned at the beginning, that it's just not sufficient. And yeah, the G7 communique, it really does contain some nice words and some sentiment of commitment around a collective goal to end the pandemic in 2022, which would be amazing, and to strengthen global action now to fight COVID, as well as taking further tangible steps to improve collective defenses against future threats and bolster global health and health security. Those are really important words and commitments. But while COVID is still raging and new powerful variants keep on appearing, we actually haven't seen any new financial commitments to end COVID globally. The G7 leaders made claims or claimed pledges that they had already made in the past without really concrete action to finance a global roadmap to end the pandemic in the coming months. So we believe that the Access to COVID-19 Tools Accelerator, Act A, is an absolutely critical initiative. And it is facing a US $18.1 billion funding gap, or an estimated $18.1 billion funding gap. And the latest estimates also anticipate that it will cost between 50 to 66 billion US dollars to fully vaccinate the world. And likely actually much more when these end-to-end delivery costs are factored in. So to answer the question of what the EU and G7 could do, we call on them to fund all pillars of the Act A, this Access to COVID-19 Tools Accelerator. And not just COVAX. COVAX is absolutely essential, there's no doubt. That is the vaccines pillar. And I mean, we've heard from Alex on the amazing work that Gavi's doing around that. And it's just so important. And of course, we're grateful for all of the solidarity that has already been shown. More is needed, but not just COVAX. There are other pillars related to diagnostics, testing and treatment, and also the health systems connector, which is one of the pillars which could provide some more support for delivery. So that would be really our key call. I've already mentioned the other areas that I think are very important around public health systems strengthening and funding, and of course support to the health workers. So I think for now my key call at the moment will be around Act A pillars being funded.
Thank you. But what do you think is lacking? Is a lack of will from the governments, or are they lost in discussions like Olivier was saying, endless discussions on how to help and to proceed, or is it really a lack of will?
I don't think it's that straightforward. I do personally believe of course it's very complex. There are so many different perspectives and there are so many different interests. And of course, I mean, there's always the question around public sentiment versus the sentiment for solidarity. There are questions around prioritization. I mean, there's just so many questions around this and so much misinformation. I mean, we've been talking about vaccines hesitancy and other issues. We do know how to address some of these problems or challenges, let's say. And as Alex mentioned, just the need for proper planning and around vaccine supply. But of course, decision makers and the EU, for example, is a very complex decision-making structure. Of course, there are so many interests and considerations within this. And interesting as well on the whole issue of intellectual property rights and patent sharing. I think Olivier very convincingly presented a perspective of the need to preserve the motivation or the incentive, let's say, for pharma to keep producing and research to keep producing new vaccines because there are constantly new variants. There's a flip side of that there are other approaches or potentially other approaches to addressing the development of medicines as global public goods. So just to say, I think there are many, many perspectives. Some of it is absolutely political will. I'm not convinced that that the entire public of rich countries and nations are really have the solidarity imperative as a top priority. But I also know, I mean, as Olivier said, a year ago, we were in dire situation in Europe. I do think, however, we could turn things around and get that political commitment and public support if we were also able to share more information about what is happening across the world. That so many countries are now facing situations as bad as or actually much worse than what we had in Europe 1 year ago. So yeah, I mean, political will is needed, but I don't want to suggest that I'm aware that it's not a straightforward issue. It's very complex, but at the base, I do think, at least in Europe, maybe I can speak as a European, I do think that we do have some shared values to support other human beings and around solidarity that we could perhaps be drawing on more to ensure that we have the political will.
Thank you, Celine. Olivier, what do you have to answer to Celine? What can the EU do more?
I think Celine is right in the fact that it's not a problem, I think, of pure political will. I think when it comes to European values, solidarity, the responsibility of Europe towards the world, we have strong values. We based our international action on them. We are quite even proud of being or trying to lead these global efforts. We are also very humbled when it comes to the magnitude of the challenge. This is why I'm saying that this will not stop by Christmas this year. So we have to ensure that we have the means and the determinations and the political stamina to continue these efforts for the next year and maybe, as Alex said, for the following year. This may be the task of the mandate of the EU institution till the next European elections. And at the same time, our leaders have to ensure that the COVID-19 pandemics will not hit our continent again after the summer. And all these concerns are not gone yet. So it's a delicate balance for our leaders and for our institutions to know which efforts are needed and at the right time. But I'm certainly agree that it's not a matter of political will. It's more the difficulty to assess the situation and to move in this very delicate environment. And we don't know the future. Let's also face it. I agree with Alex. It's important to plan and to give to third countries a sense of programming so that they can prepare their campaign. But the future is not written, and this pandemic, being the unprecedented, doesn't give us the full chapters of its history yet. We have to evolve and be very flexible in our answers in the coming months, and especially after the summer. We don't know if vaccine manufacturers will be up to their legal and industrial commitments. We don't know which variant will come. We don't know if the heat that we see now of COVID-19 in Moscow will be a problem for the whole Russia or only for St. Petersburg and Moscow. We don't know if the situation in Africa will be limited to some countries or will hit the whole continent. We were lucky for Latin America. We saw it in Brazil and a few countries, but it did not spread to all Latin America. It seems that China seems to control this. It was quite unprecedented and maybe sometimes unbelievable. Let's see India. So voila, there are a lot of variables that are quite difficult. So with all the political will that we want, we have to admit that we don't know the future and we cannot face the situation alone. This is why I think the European answer is limited but correct. We need to, it needs the world to vaccinate the world. Only multilateralism, cooperation, acknowledging the contribution of China, of Russia, of India, of US, of COVAX, of WHO, of ACTA, all that are elements that goes in the right directions. And we need to have this discussion globally. This is why we hope that the summit, the United Nations General Assembly in September, led by our European Secretary General of the UN, Mr. Guterres, who was in Europe last week. The G20 presidency, Italian presidency of the G20 and the summit in October would be important moments of multilateralism with a strong European lead to ensure that we move forward in this multilateral and global efforts. This is our hope. This is where we will put our efforts. And I think, to be honest, that after a while, what we started the conversation with vaccine diplomacies, this is a bit fading away. It's true that China is still donating to key countries that they have an interest, but in total, China has donated less than 20 million doses to the world. They export 400 million doses, which is much more important. It's a commercial interest. But this tactical move of trying to donate to those who recognize Hong Kong or not recognize Singapore or Taiwan, this is secondary. I think the contribution of China, for example, if they are really vaccinated so far, 700 million Chinese citizens, and if they are exporting 400 million doses, that means China by itself has been able to vaccinate around half a billion people on the planet. If EU has been able to vaccinate so far 1 or 2 doses, around 300 million people in the EU, and if we have exported around 400 million doses, that means the EU in 6 months have been able to vaccinate around 250, 300 million people on the planet, especially in the EU. But if you put all these efforts together, but China and the EU are close to 1 billion people around the world vaccinated thanks to this. If the other can join this, and if we add another semester of 2021, and if we add the effort of COVAX, which hopefully will be able to deliver on its very ambitious targets, which we hope if we meet again in 6 months' time, or if you invite us next summer, I'm sure we will have done huge progress. It takes time to vaccinate the world. This cannot be done in 6 months or in 1 year. So let's be humble also on this, and let's all do our best. That would be our priorities, to be honest.
Thank you, Olivier. One last for each one of you. One last challenge. What was the biggest challenge of this pandemic for you, and what is the biggest lesson learned in the last 1.5 years? Really quick. I start with you, Olivier.
Well, I think the main challenge was for the Europeans to overcome national reflex and to work together. Everything starting in Italy last year, and we all think that it will stay in Italy. Wrong. We all close our borders. Wrong. So that is probably the main lesson in every crisis in the EU, where everybody thinks that they will be safe. So it's an important lesson learned. And where I was most impressed, to be honest, is to see how comprehensive is our answer and how we are able to speak to everybody around the world when it comes to vaccination. We have not alienated anybody, and we are ready to work with anybody and to help those who in need. I think that is a very important lesson and a very positive message also coming from the EU. Thank you.
Thank you. Céline.
Thank you. Goodness, that's a difficult question. A lot of challenges. I'm going to speak with my CARE International hat on, as a humanitarian and a longer-term development organization. The biggest challenge, I have to say, was that we faced really an unprecedented global humanitarian situation with this COVID-19 pandemic, because we've had the health situation, but it's been compounded by so many other impacts. And that's maybe the other thing, is that while we need to address the pandemic through a global health response, we also need to recognize the impacts on hunger, on our economies. I mean, the scale is just so vast. And for us as humanitarians, I mean, we really had to work around the clock to ensure supports. But of course, you know, I'm slowly optimistic that we're going to at least start to move forward. But as I said, I really think we need to be more ambitious and move more quickly. And yeah, for that, indeed, political will be important. Yeah, thank you.
Thank you, Celine. Alex?
I think the biggest challenge for everyone, whether it's countries, partners, or Gavi, from my perspective, has been, we've been trying to do what we were already doing, which was immunizing and delivering health services to hundreds of millions, billions of people routinely around the world, and ensure that continues. And in fact, we continue to ideally progress and reach those who were not being reached. And at the same time, stand up an unprecedented effort to immunize the global population. And I think that's that stretched everyone at every level of every system. And it continues to stretch everyone at every level of every system. And it's, you know, it doesn't matter whether, you know, my country, the UK, you know, it's blessed with the NHS. Even it struggled to do that. And, you know, those problems are even greater when you look at countries that aren't lucky enough to have such strong health systems. And so that, you know, I think not losing sight of the fact that there could be even more deaths from other diseases than from COVID-19 if we don't manage to maintain those services, and maintaining a focus on other health problems has been one of the biggest challenges, while also making sure that we do get this pandemic under control. I think in terms of lessons learned, I'd love to say we have loads of lessons about our state of readiness. I think the reality is we actually knew many of the things that we could have anticipated, many of the problems we've had. We've certainly learned a lot, Gavi and COVAX, about what it takes to do what we've tried to do. This is the first time anyone's tried to set up a global mechanism to buy and deliver vaccines for the world. And that has been, you know, we've got some things right and other things we've not got right. And we've learned a lot from that. But I think one thing we've certainly learned is that it's needed. And it is absolutely epidemiologically certain we will have another pandemic. And we need to learn from this pandemic what worked with a multilateral mechanism like COVAX, what didn't work, and how do we make sure next time we're ready because we've fixed the problems and that we have the mechanisms in place, the financing in place, and the delivery systems in place to be able to respond rapidly.
Thank you, Alex. Well, thank you very much to all of you. It was such an interesting discussion and such a good way to learn more about your work and how we can learn from this pandemic for the future, because we will have challenges ahead. And I will close with one of Olivier's sentences. It needs the world to vaccinate the world, and I think it resumes quite well the challenge ahead. And we are almost ending this conference. The closing remarks are being with Francisco Seixas da Costa, Elder da Costa, and Augusto Santos Silva, our foreign minister. So thank you very much to all of you to participate, and to our audience to be with us. Thank you. Obrigada a todos.
Obrigada. Thank you.
Thank you.
Thank you.
Muito boa tarde a todos pela
Good afternoon. This is the closing session of our conference. I'd like to start by thanking the significant participation of those who have been following us during today's sessions. I'd like to thank in particular the speakers who were in the different panels. It was very gratifying to be able to listen to great speakers. These conclusions led to very important conclusions, and the Clube de Lisboa, together with G7+, has organized. We're very privileged with your participation. International life is going through a unique moment. COVID-19 pandemic has not left anybody unaffected, but it's a huge mistake to conclude, as we hear sometimes, that we're all on the same boat. We are not on the same boat. And what we've heard during the day is such an evidence in societies. There's been a clear social asymmetry in the consequences of this crisis, with an increase of inequalities and negative impact on the poorest and those with few resources, with very different impacts on the life conditions of families and access to work. But also internationally, the world pandemic has expanded, has had a very different impact on countries. G7+ includes fragile countries in institutions, in resources, affected by conflicts, sometimes very long conflicts, and also in the memory of conflicts. The conditions for these countries are very difficult on our daily lives, even when things are business as usual, but becomes even more dramatic when their daily lives is afflicted by catastrophes or pandemics. COVID-19 is a new reality, but for some of these countries with health conditions which have scarce resources, both material and human resources, the increase of acute diseases which in the developed world have been controlled, or epidemics such as Ebola and others, which the precariousness of social conditions disseminate. This pandemic crisis has brought about what we can call as vaccine nationalism, the rapid appearance of an attitude of retraction to protect producing countries that have clearly forgotten the access to third markets. But the fact that they were hitting their immediate interests were then followed by some tokens of solidarity in view of developing countries, but this is not sufficiently enhanced. And it should be fair to say that Mr. Guterres has been one of the world leaders who called for the first time the attention of the industrialized world to have an attitude of generosity towards the rest of the world. I don't know if I'm being fair, because this sort of assessment is based on perceptions that we are forming. But I believe that the reaction of the EU was not as quickly as it is its responsibility in view of its historical partners in the less developed world. But let's go back to inequalities and the impact of that these strategies have. The great lesson of moments like this one, as it's been the time of the financial crisis in 2008, is the realization that the world is not equipped, institutionally speaking and politically speaking, to find rapid solutions for urgent problems. We're all taking note of the goodwill that GSAT has manifested in relation to vaccines, but let us be clear, it was a bit too little and too late. Even today, with decisions made, we ask ourselves how long until they are truly implemented, how many people will die from COVID-19 in the least developed world until that moment. We've all seen that when G7 understood in 2008, when we had the financial crisis, that we had to take on board many other economies, it made an effort to rekindle G20. But when most of the emerging countries ask this collaboration to be guaranteed in the Bretton Woods institutions or the absolute balance of power in the EU and Security Council, the openness was much more limited, and the consequences are here to see. But maybe we should all be more modest, and we have to think that not always what is good, even for the world of emerging countries, is necessarily good. For the most fragile states, be it the least advanced countries or those emerging from conflicts with very weak structures, this pandemic has proven the need of giving strength and instruments to multilateral structures which have the mission of dealing with catastrophes and managing early warning structures for health crisis at global level. In Don Quixote, Cervantes said a certain place at Mancha whose name I don't recall. I like to say the same in relation to a former American president who I'd like to recall, which had the goal of dismantling multilateral world, which defends the most fragile. This nightmarish time is now behind us, but I believe that's a true window of opportunity which we now have with the favorable combination, I don't know for how long, of three factors. On one hand, the attitude of Biden administration regarding multilateralism. I can't forget the expression made by the permanent representative of the United States in the UN saying multilateralism is back. Remarkable, something that we've taken note of with a great deal of goodwill. And then the European will of becoming a world player. It's an era where the European Union has been facing some difficulties. They're looking very much into its internal issues and has forgotten its nature of soft power and promoter of international relations in terms of development. And finally, the third factor, which is very positive, is the re-election of Mr. Guterres as the United Nations Secretary General. Is it possible to give the United Nations and the surrounding agencies the means to give the world some instruments to regulate the future? This agenda is arguable and questioned by China, and saying that the fact that they are developed countries, a brand image that they want to pass on. Let's see if the efforts are all combined. Thank you very much for your participation. The Minister of State and Professor Augusto Silva has given us honor of sending us a message on this conference, and specifically for this conference that we're going to see in a minute.
Senhores conferencistas, em primeiro lugar, muito obrigado pelo convite e o elogio devido pela organização desta segunda Conferência de Lisboa sobre a fragilidade dos Estados, desta vez subordinada à temática geral da pandemia, vacinação e solidariedade. Farei esta intervenção em dois tempos, no primeiro dos quais me referirei à questão específica do relacionamento com os chamados Estados frágeis e depois, num segundo tempo da intervenção, dedicar-me-ei em particular ao tema da pandemia e do combate à pandemia Covid-19. Portugal, como todos sabemos, valoriza muito o trabalho que o G7, Mais e Timor-Leste em particular, têm feito através do diálogo e da aprendizagem entre pares, na defesa de um apoio adequado e empenhado aos Estados em situação dita de fragilidade, para apoiá-los no enfrentamento das respectivas vulnerabilidades e no desenvolvimento das suas capacidades. Todos sabemos que precisamos do multilateralismo. O multilateralismo é um imperativo, a cooperação e o empenho multilateral são muitas vezes remédios para vários dos males de que o mundo sofre.
the evils that the world suffers from, and the current situation requires from our side joint efforts and cooperative actions. Within this framework, support provided to countries in situation of fragility is a priority, not just politically speaking, but also in terms of the concrete cooperation and projects with visible results. This is what Portugal believes, and this is what we do in terms of our cooperation, both in bilaterally, namely with our partner countries, be it in its multilateral actions. On a bilateral level, the support to national institutions and fragile states is essential. We support national relevant stakeholders, supporting this situation of fragility to develop resilient societies, which implies a work of making institutions become more robust, strengthening the state, improving the ability for the state to provide services to the populations, to protect them, to take care of human safety, and also as far as within their own competencies, important of the state to contribute towards the reduction of social and economic inequalities and protect the least favored and those who are in most vulnerable situations. This is what we do bilaterally. On a multilateral level, we've always defended a particular attention to contexts which create fragility. This should be done through integrated approaches, addressing the different dimensions which deal with the situation, and also approaches which are specific to each situation, because each context is specific, and we have to approach them as specific tools. So two essential concerns taking on board the different dimensions which make up fragility, following a systemic approach, and on the other hand, to have a case-by-case approach which enable us to recognize the specificities of each context and find solutions for these specificities. We defend the integration of SDG 16 concerning peace, justice, and effective institutions in 2030 agenda. And we did it together with G7 plus countries with whom we share the conviction that we can't have sustainable development without peace, without stability, and in turn, without sustainable development and without the poverty eradication, we can't find lasting peace. And in recognizing the importance of giving voice to the countries in situations of fragility in multilateral platforms, we consider that G7 Plus is a very relevant informal group and very well positioned to represent the voice, the states in a fragile situation. So to be coherent with our opinions, we support in 2019 the wish of G7 Plus to become observer in the United Nations. G7 Plus, and in particular East Timor, will always count on Portugal. They will count on Portugal to work in the agenda for sustainable development, and they can count on Portugal in terms of our support in growing their institutional resilience, organizing their own states to serve the populations. Now let me move into the second part of my intervention. And I believe that we now better understand how we can approach COVID-19 pandemic, which represents a global challenge and which strengthens the need for of us to work together, both bilaterally and multilaterally, and working all together in a more effective way. This pandemic crisis has again reminded us of the importance of collective actions, effective and concerted action, and also reminded us of the need for us to grow in our spirit of solidarity. And it showed that we have to practice more the spirit of solidarity and mutual aid, because this is truly the only way, this collective action of solidarity is the only way to respond to global crises and emergencies, because these crises and emergencies know no borders, and their consequences both on health, education and on society affect all, but they affect all in different ways. It has more nefarious effects on countries which are more fragile and more vulnerable populations. The current crisis has the dimension that we all recognize. However, we have been progressing in a short period of time in fighting the pandemic, namely vaccines development. The vaccines which are currently being used were very rapidly discovered, manufactured and distributed, and this was unprecedented in the history of world vaccination. Actually, it was thanks to the joint efforts at the highest level, at the global level, and the rapid mobilization of public and private, that it was possible to give this unprecedented qualitative step to deliver safe vaccinations for COVID-19 in less than a year. In this context, Portugal supports a multilateral, coordinated, concerted action in combating the pandemic. Besides our participation with a commitment 10 million euros in a global response to the pandemic, led by the European Union, Portugal, at a bilateral level, has assumed its own commitment of donating to Portuguese-speaking African countries and estimate at least 5% of the total vaccines we are entitled to in the common acquisition process at the European level. It means a considerable effort on our side, but which we deem necessary. We're talking around 1 million doses, and a process which already started and which we want to be running at full speed during this year. We are currently combating the pandemic with good results, and so that we all feel safe, nobody should be left behind. Vaccination has to be universal. So actual and rapid distribution of vaccines is currently one of the major issues the world has to face with, and one of the major responsibilities of the international community. This equitable distribution and universal scope of vaccines should take particularly on board the situations of countries which are in a fragile situation, and we should never lose sight of this reality. Vaccines are global public goods which should be accessible for all. We also need, and this is my concluding observation, that the context of fragility require more effective action in other areas. At the EU level, we talk about the so-called triple nexus, development aid, humanitarian aid, and peace, and this triple nexus the link between humanitarian aid, development aid, and peacekeeping action should always be in our mind, directing our actions. This is true for all, and it's particularly true for these countries. I'm afraid there is no sound from the video. There is no sound from the video.
Muito boa tarde, senhoras e senhores.
Good afternoon, ladies and gentlemen. I'm going to address you in English.
Gentlemen, all protocols observed. Allow me on behalf of the G7 Plus and the Club of Lisbon to read out the organizers' conclusion of this conference before closing the session. Organizers' conclusion. The G7 Plus, as an intergovernmental organization of conflict-affected countries, and the Club of Lisbon, a Portuguese private association that promotes the debate on global challenges, co-organized this second conference on state fragility, on pandemics, vaccination and solidarity, implication in fragile countries, which was held virtually today on 28th of June, 2021. The conference was attended by members of governments, senior officials, and representatives of multilateral entities, members of the academia, the media, and the civil society and the private sector. The objective of this year's conference was to discuss the implications of the COVID-19 and the process of vaccination in fragile countries, and to encourage the strengthening of international solidarity and cooperation towards the more vulnerable countries and communities. The organizers took note of the most relevant issues debated and stressed by the participants as follows. First, recognizing the disproportionate adverse impact of the pandemic in conflict-affected countries, such as those in G7 Plus group, participants underscored prioritizing support to be provided by the international community. Second, realizing the increasing level of violence in the already conflict-affected settings, a strong plea was made for pursuing ceasefire. Participants called upon the international community, in particular the United Nations, regional powers and organizations, to spare no efforts to help stop wars. The common challenge to defeat the pandemic can only be addressed if countries are in peace. Third, commending initiatives such as COVAX, concerns were raised on the inequality in the distribution of COVID-19 vaccination. Recognizing that no one is safe until everyone is safe, it was underlined that developed countries and international organizations should ensure that the world's poor countries and populations are not left behind. Fourth, as the COVID-19 unleashes fragility in the global and national systems, participants emphasized on the need to invest in institutions in fragile and conflict-affected countries to make them more effective and responsive. Fifth, participants emphasized on the need to speed up production and distribution of vaccines. Its concentration in a few developed countries is slowing the pace of vaccination of the entire population of the globe. Various possibilities were proposed, including the waiver of patents, the removal of export bans of vaccine components, as well as the need to create and finance vaccine production facilities in developing countries, including in those with fragile institutions and economies. Lastly, participants underscored the need for global solidarity and cooperation as the only way to mitigate the grim and long-lasting impact of COVID-19, with a sense of acting urgently in poor countries. Against these premises, progress of the implementation and lessons learned will be disseminated by the organizers. Furthermore, the G7 Plus, representing 20 fragile countries or conflict-affected countries in fragility, is keen to continue to explore opportunities to strengthen its partnership with the European Union and its member states through all available effective means to fight pandemics and to guarantee free and fair vaccine for all, with a special attention and priority for more fragile countries and vulnerable communities. Statement issued by the Secretariat of the G7 Plus and the Board of the Club of Lisbon, 28th of June, 2021. It is my pleasure to share with the participants around the world that this organizer's conclusions will be submitted tomorrow morning by the co-organizers led by Ambassador Seixas da Costa and myself to the Minister of Foreign Affairs of Portugal, who just spoke to us today at the closing session. Finally, on behalf of the G7 Plus Secretariat and also the Club of Lisbon, who spoke already by Ambassador Seixas da Costa, we would like to express our sincere gratitude to all the invited speakers, moderators, and participants across the globe for being with us today in this very important topic of this conference. In my humble opinion, the discussions have been very illuminating, insightful, and informative. And we thank for all the audience across the globe for being with us today. Lastly, I'd like to say that the co-organizers will make a publication of the proceedings in due course and will be shared with you internationally. Thank you once again for being with us, and see you again next conference. Thank you very much.
You're out of gear. Session is finished.